Hi, this is Cole Whitaker. I'm the Chief Commercial Officer at Powered by MRP. Today we're going to be discussing the Edge 1 CO2. I have a special guest here with me today, Susan Brighton, nurse practitioner from Rose Clinic in Utah, as well as Dr. Jason Choak. They will introduce themselves and we'll get started with the slides.
Hi, I'm Susan. I have been using the Edge for about a year, maybe almost a year and a half. We do quite a few procedures. We do light treatments, moderate treatments, and really aggressive treatments, even under sedation. So it's one of my favorite treatments, probably top 3 of our clinic's procedures that we offer.
Hey, I'm Jason Choak. I'm a board-certified dermatologist from Cliffside Park, New Jersey. Just here today to learn about the Edge 1. So nice to meet everybody, and thanks for teaching me, guys. Appreciate it.
It's our pleasure. So when we do a train the trainer, what we want to do is go through the expectations of the same slide deck that you will use when working with your trainees. So we'll walk through this. Within the slides there's more information than what we're going to go through today. And we encourage you to go back afterwards and spend some time with the PDF that we send out and really understand this system. It's a really nice system. It's a fun system to work with. It's incredibly capable. The system is only as good as the practitioner, and the more you understand, the more you learn about this system, the better off you'll be. So let's go ahead and get started. So there's multiple pulse structures that you're able to choose from. That traditionally we're using a high peak pulse, standard CO2 pulse using a 30-watt CO2 tube. Well, with that delivery, your power and your pulse duration affect the energy. So this is not listed anywhere in here, but power times pulse duration equals energy. So if you have a 30-watt CO2 set at 30 watts and you're at 2 milliseconds of a pulse duration, that means a 60 millijoule energy. So that's your standard pulse that will be used with most settings throughout the Edge 1 CO2. But there's an additional pulse structure called the Edge pulse. The Edge pulse is a very short pulse duration. It's reflected beneath the energy on the screen. So when you choose Edge pulse, you'll go up, up, up. You'll go 20 watts, 21 watts, 30 watts. Essentially where 31 watts would be on your touchscreen, that's where you get to the Edge pulse. And so it'll change. It'll say Edge pulse on your screen. That's that really high peak power with a short pulse duration. The idea behind Edge pulse is to get in, get out with a high ablation to coagulation ratio. And so that's going to be safer on, let's say, darker Fitzpatrick skin types, Asian skin, anything where safety is the biggest concern, and Edge pulse should always be considered. But when you're doing, let's say, an edge peel on a skin type 1 through 3, you may be underwhelmed with the results of that. And Susan's nodding as I say this, that the edge peel is such a short pulse duration. It's always going to be a small spot size and lots of room around each one of those dots. So that's where we also have the vanity peel. And so we'll discuss both of those options as we talk today. But the edge pulse is a very short pulse duration. It's used in very specific incidences. And in my world, it really exists specifically for edge peels. Susan, do you use it at any other time?
We actually probably do more aggressive treatments than the Edge pulse. So I have a handful of people who might want the vanity peel maybe 2 weeks before a wedding, but usually if they're going to a CO2, they want a much more aggressive treatment. So yeah. I don't use it commonly, but I have used it.
Yep, yep. One thing that I always think about when you've got an event coming up, make sure you've got plenty of time before that event to introduce anything new to their body, because you have no idea how their body's going to respond. So, you never want to do a big aggressive CO2 when they've got a wedding coming up in 3 weeks, because what if they're still erythematous or something like that? So,
yeah, for sure.
Susan's right. The vanity peel is pretty predictable. We know exactly what we're going to get with that. Would you say you ever have more than 3 days of redness? And
not on the vanity pill.
Correct.
Yep. Nope. And really, I would say 2 days is probably where we're at. So, and it definitely, like you said, is somebody who I've done a few of them already on, or we've done a couple other treatments. So we know and can anticipate how their skin is going to respond.
That's right. That's right. So beam patterns is the next thing. So you're going to have the ability to choose from first size. You've got your 120, your 350, and your 800 micron spot sizes. In my world, it's really about the 120 and the 350.
Correct.
Susan's nodding along. 120 is either anything vanity peel or edge peel, where you're trying to stay superficial, and part of the secret sauce of those rapid recovery, you've got a small spot size, short pulse duration, and plenty of room around each one of those microbeams for the heat to dissipate into, so that it doesn't create collateral damage or collateral thermal damage. So anytime you're doing a vanity peel or an edge peel, you're always going to be using the 120 spot size to help with the rapid recovery. The 350 spot size is really dedicated for epidermal only treatments. So you wouldn't want to take the 350 spot size and try to drive through the dermal epidermal junction, because what's going to happen is you're going to destroy more melanocytes than you wish to, and you could wind up with hypopigmentation or spotty hypopigmentation, because the depth of the epidermis is not necessarily completely consistent across the face. It's generally regarded as 100 microns depth of penetration on the face, but around the muzzle it might be thicker, around the eyes it's thinner. So the 350 micron spot size is intended to do epidermal treatments, and the 120 micron spot size can do either dermal with the correct settings or epidermal low downtime style treatments. The 800 micron spot size was designed for doing very superficial, like buffing and polishing style treatments, but we just decided there are better ways to do that with the vanity peel, edge peel, et cetera. So I don't necessarily suggest a setting for the 800 micron spot size. Do you agree?
Yeah, we don't use it very often. Sometimes in my higher Fitzpatrick, when I want to disperse the heat a little bit more, I'll use it. But we've also had like protocols for them that they use pre-treatment, just to make sure they're safe. Really.
Yeah. Well, safety is always the number one concern, and when you go to a big spot size, you're spreading out the energy. So the energy is going to come down the arm, right? So the machine makes power. That's the wattage. The tube itself is creating power, and then once you apply a pulse duration to that, it becomes energy. Energy comes down the articulated arm to the handpiece, and once you give energy a spot size, it becomes fluence. Well, if your fluence for any one of those microbeams is too low, you can become what's called subablative. And that means that you're not actually ablating the skin. You're dumping the heat in without the benefit of the heat escaping. We need for that heat to be able to escape, and the identifying clinical endpoint for you is to be able to see a whitening of the skin, that char that you see on the surface of the skin. That's necessary to know that you're reaching the ablative threshold. In the absence of that, you're simply bulk heating, you're subablative. And with the 800 micron spot size, part of the reason I'm not in love with that is that I do have to use a high energy in order to get to a high enough fluence at 800 microns. And so when you do that, there's a lot of heat going in there, and we need to make sure that heat gets out. So my love is really for the 120, the normal one, not the S, the 120 or the 350.
Yeah,
and
those are the two that I hands down use every single day on every single patient.
Yeah.
Those are my two.
Good to hear. And the machine will pick it up. You don't have to do anything special on the machine. As soon as you connect a tip, the machine recognizes you've got the 120 spot size on there. Your GUI will change a little bit because your densities are different, whether you have the 120 spot size on there or the 350. And so the machine picks up on that information and will correct that for you. There is a surgical mode on this. We don't necessarily train the surgical mode. If we have time today, I would like to do this, maybe just on a banana. Because in a training, you would never do anything more than training on an inanimate object. My favorite is a chicken with the skin on it, because what I like to show is that with the proper selection of power, I'll use continuous wave usually, with the correct selection of power and then speed of your hand, you could cut through selectively only the skin without affecting the meat below. And this is something that a doctor can practice on his own, and long before ever taking it to a patient, they can practice and really understand and refine their skills with this surgical handpiece. And then what you have essentially is a cauterizing knife. That in lieu of using a scalpel for surgical procedures, you could use this surgical incisional tool in order to cut the skin and then cauterize behind itself. Very cool. We do not train any surgical procedures, and we would never ask you to do so. So if a doctor's expectation during your training is that you're going to teach them how to do a BLAF, call us. We'll have that conversation and make sure that that's not what's going to happen today. Really you need to practice long before you ever treat a human being with the surgical handpiece. There is a VLR option, and right now we are in talks with JASIS about making this available to the U.S. It has not been an option in the past, and it does exist. And so we would like to be able to offer this as an upgrade to existing customers as well as people who are purchasing the system. But if that does become an option in the near future, we'll have a dedicated video to that procedure.
What was that?
Vaginal rejuvenation. On the screen, it's referred to as VLR, and that's just vaginal laser rejuvenation. And it is a wonderful procedure, but right now it's not available on the Edge 1. So the Edge is a modern super pulse CO2 laser system that includes a fractional scanner, surgical handpieces, and that optional vaginal accessory that we talked about before. The fractional scanner is where most of your time will be spent unless you are dedicatedly using this as a surgical tool. It is a very nice system, very versatile. It's the only fractionated system that's going to offer those different spot sizes, convenient handpiece controls. We'll talk about this in a few minutes. The choice of the spacing, the ability to change the density just on the screen very, very quickly, and then that advanced super pulsed modality, the Edge pulse that we talked about before. The flexible scan patterns really make this easy for the practitioner to really get exactly what you're looking for on every patient. Simple specs right here. You can actually see the graphic of the different shapes. We'll talk a little bit more about those. I prefer the square for everything. If I'm going to do a triangle, I'd rather just take a tongue blade, and Susan can show you this later on, to where you block off the area you don't want to treat, and then you just treat over the top of the tongue blade. But you do have the ability to change your shapes to match the area that you're trying to treat. And then you've got scan patterns that I prefer the scatter for everything. Do you use anything other than scatter?
I probably 99% of the time use the scatter because I like to kind of disperse the heat a little bit versus the standard, which lays it down in like a line, kind of keeping your heat from one side to the other side. The scatter just really helps kind of plot it all over. So I'm really careful that I don't overtreat or overheat a specific area too quickly.
Excellent point. And to give you, normally I would talk with my hands, and you'd see this visual of me doing a typewriter type of motion with my hands. And so a standard delivery would be just making a line across and then turning around, going back the other direction, and you're almost doing this serpentine pattern across the skin. Well, the challenge with that is, as you round that corner, the heat from one microbeam is going to run into the heat from the adjacent microbeam, and you can cause collateral damage, collateral thermal damage. So what the random mode does is it takes the entire area of that scan with all those dots, and it's an algorithm to lay down each dot as far away from the previous dot as possible. So it's a very scientific approach to maximizing the thermal relaxation time of the skin and allowing the heat to dissipate just a little bit, because remember, we're talking about microseconds for TRT for these injuries. Well, the heat can dissipate out before the adjacent pulse is laid down. What scatter will do is take that same algorithm where it dances around the area of the scan, but it also takes each one of those plot points and moves them slightly off center. So instead of being a perfect grid, like straight lines, remember, there are no straight lines in nature, so instead of having straight lines everywhere, you've got this sort of natural looking appearance, and everything looks much more natural for the patient afterwards. This is important when you're doing low downtime procedures like vanity peel, etc. When we do aggressive treatments, the scatter doesn't have much of a benefit because the dots are so much closer to one another, so there's really not room to move them off center as much, but I still keep the setting at scatter for every one of those patients. Would you agree?
Yeah, that's what I do.
Scatter is a random plus. It includes random.
Correct.
Okay.
Yeah.
Correct. And the random you would want to think of, it's actually the opposite of random. It's an algorithm. It is a math equation that makes it dance around the surface area without laying two pulses adjacent to one another. And that's done for the benefit of the patient, for a better healing process, more predictable outcome, and it should always be used, or scatter should always be used for that reason. In the surgical mode, you can use your, there's a surgical tip, so one of the plastic tips, just like the 120, the 800. There's one for surgical that you can use if it's just something quick that you want to take off a barnacle. essentially, one of my friends said, if it sticks up, you can knock it down. Yeah, Susan's heard me say this before. If it sticks up, you can knock it down with the CO2. The CO2 is just targeting the water content of the skin. If you really think about that, 70% of our skin is water. So, if you're flash vaporizing the water content of the skin, you are vaporizing that skin. So if you've got a little bump, doesn't matter what the diagnosis is, Dr. Choak would diagnose it and say, this is something that can come off right now, and I could cut it off, or I could just, ablate it and cauterize behind it as I do this. And so, a very useful tool. It can be done either with the surgical tip, that's a plastic tip that attaches to the normal handpiece, or it can be performed with the incisional handpieces that come with the system. And you can use a pulse delivery. I think just about every person I've ever worked with on this surgical handpiece or surgical handpieces with similar systems will use a continuous wave. If you use a pulse delivery, if you work slowly, it looks like a line. Whereas if you move your hand really quickly and you're in a pulse delivery, it looks like a dotted line. And the benefit of that is less heat. There's less coagulation. Remember, with CO2, we're always talking about that ablation to coagulation ratio. And so a pulsed mode gives you the ability to create a line when moving at the correct speed, but quite typically people will just move to a continuous wave, and then they're working with a lightsaber. That everything that it comes in contact is going to vaporize. And the closer you are to the tissue, the smaller the spot size. And as you pull away, we'll do this with the banana later, as you pull away from the skin, that spot size will grow. So a fun tool to work with, but not necessarily what we're training on. Here are the selectable spot sizes that we'll work with. The 120S is just a smaller scan shape than the standard 120. I prefer the 120 for anything I'm going to use that 120 for. Susan's nodding.
Yeah.
Yeah. 350s are really the standard of what I'm doing most of the treatments with. The 800 is there. It's available to you. If you find an application that you love with the 800, please let me know. And then that surgical tip, that's what we talked about, that could be used for just a quick application. I just need a single spot. I need a dot. I want to take off a skin tag or something nominal like that. You could pop that on real fast without even disconnecting the handpiece, and that should make it really, really easy for you. You'll notice that the densities are different from one spot size to another, because you wouldn't want to take a 120 spot size and try to go full field ablation with that. The scan would take far too long. It would be like a 4-second scan to try to fill in the full surface area using a small spot size. So the 350 spot size is multiple times bigger, and a lot of people will think about this, that if you double the diameter of a circle, you quadruple its area. So a 350 is not twice the size or 3 times the size of a 120. It's multiple times the size. And so that means that the scan duration to cover 100% of the surface area is much, much shorter with the 350 spot size. And so anything that's going to be higher density should be performed with the 350 micron. Susan, why don't you talk about the handpiece controls? This is something that you may use in practice.
Yeah, so we use the handpiece controls to change the shape of the scan,
yeah.
right? So I personally almost always use a square, like you said.
Yeah.
I don't change it very often. I do occasionally change it to a circle, and I just push the handpiece with the up triangle, and it'll just kind of click over on the machine. You can kind of just make sure. But when you're scanning, you can actually see like a red beam on the skin, so you can see the shape of that scan that you're going to be doing. So let's say I have like an AK that I'm really targeting really deep. I can actually measure the size of make sure I'm in like the perfect circumference of that. So I don't damage any other skin around it. And then you can change the handpiece, the tip size. So 15 millimeters all the way down to 2 millimeters, depending on the size that you want. So if I'm doing like, let's say an acne scar that's really, really bad, I will change it to a circle really quick and then kind of manipulate the size of that circumference to fit that area that I'm trying to treat for one pulse or something.
That's perfect, yeah. That's a perfect use of that. These same manipulations can be made on the screen, so you can turn around. These are designed to make it where you don't even need to turn around. You can see it as you change your shape and size right there with the aiming beam. You're going to have a red outline of where your scan would go. So if you were to change from a square to a triangle, you would immediately see the triangle with your aiming beam, and then you can titrate the size as well.
Yeah.
Scan patterns, we talked about this earlier. I forgot there was a graphic in here to act out what my hand animations were going to do, but you can now see better visually that the standard was going to be kind of a typewriter. The refresh gave it a little bit more of an advanced approach to it. The random is that algorithm that we talked about, and I'd love for you guys to use that word algorithm. That's the correct word to talk about this, that it is a mathematical equation that places every pulse as far from the previous pulse as possible. And then that scatter, if you look closely at the little gray dots, you'll notice that they're not in straight lines because there are no straight lines in nature. So a perfect grid pattern is not natural looking, whereas that scatter pattern looks very natural to the patient. It's more pleasing to the eye, allows you to sort of feather out the edges without having to bend the beam or flick the beam or whatever. There are all sorts of different ways to make that kind of blend out in the edges. The scatter mode is sort of doing that for you. There's an explanation over the right on this next slide of talking about Gaussian beams versus a top hat delivery. So the Gaussian is where it's got that hot spot in the middle. That's not ideal when you're doing ablation. You really rather have what's over on the right-hand side, and that's what the Edge 1 is performing, is a top hat delivery. So you'll hear people ask, is this beam Gaussian or is it top hat? It is a top hat delivery, and what that means is that edge to edge and across the middle, it's going to be very similar fluence. So that means that you're not getting bloody spots in the middle. You're not a higher fluence on the edges than you are in the center. It's very flat top, and that's an actual measurement of this beam performed there on the side. Your screen looks like this, and this may be a good moment to kind of discuss the screen itself. That starting in the top left-hand corner, that's your density. The density will determine your downtime. So a good alliteration to remember there. Density determines downtime. That higher density treatments, especially with the 350 micron spot size, are going to help determine the downtime for that patient. And so the two different scan sizes or spot sizes that we're going to talk about today have different maximum densities. And those densities are not a direct correlation to what you see on the skin because there's a zone of thermal, of coag that surrounds each one of those microbeams. So at its maximum at 41% density, the 350 spot size is really doing full field ablation. It's doing 100% density once you include the char that surrounds each one of those microbeams. So we'll talk about the relationship of that today when we do live treatments. If you figure with the 350 micron spot size, if 41% equals 100%, you might deduce that 30% is 75%, 20% is roughly 50%, and 10% is roughly 25%. So Susan's saying roughly, yeah. And there's no exact science to that because the higher the energy, the higher the coag zone is going to be. The larger those dots become essentially. So you do always have to use your eyes. Trust your eyes. Your eyes are more important than anything that's on the screen. What do your eyes see? Do you see white dots? Do you see full field ablation, or do you see fractional ablation? So trust your eyes and make adjustments accordingly. And if you're not seeing what you want to see, turn around to the screen and make a change. Don't just barge forward because that's what the chart said, because something may not be right and you're missing that one thing.
You
No.
never go higher than 40%.
41% is the maximum
That's the max,
possible on the screen, but 41% with the 350 micron spot and a typical fluence is going to be full field ablation. So when you're doing perioral or periocular treatments, very commonly the gold standard for those applications is full field ablation. And what happens is there's nowhere for the heat to go, so it sinks. Gives great dermal heating. And this has been a gold standard indication for CO2 for many, many years, that having worked with dozens of CO2s, people are always trying to say, well, deep fractional ablation, is going to get the job done. Deep fractional can be a part of it. And Susan, do you normally do a deep fractional pass before your full field ablation?
I do.
So she's
do.
nodding,
Yep.
especially for perioral rhytids.
Yep.
Your patients are coming in with these perioral rhytids. They've been treated with IPLs and RF microneedling and all these things in the past. The gold standard application for this is CO2 in full field mode. Now, what you can do special with a system like the Edge 1 is you can do a first pass with your 120 micron spot at a high energy to go deep and lay down some dots with a very low density. Now, just remember that density and energy should always be on like a pulley system. That is, one goes up, the other one needs to go down. So the higher the energy goes, the lower the density should be in order to maintain safety. So if you're going to go high density, you may have or if you're going to go high energy, you may have a density of 1 to 3%. something really, really low. So your first pass on the perioral rhytids may be high energy with 3%, and then you go back over the top of that with your 350 micron spot size, and that's where you do full field ablation over the top of that. And when you do full field ablation, there's nowhere for the heat to escape, so it just sinks into the tissue. That's going to be typically 7 days of downtime, depending upon your treatment settings, and gold standard application. Now, always remind the patients that neocollagenesis really takes 3 to 6 months to see the results. And Susan works in a plastic surgery center, so she's nodding like this is something that patients have to understand. They don't come out of a treatment today looking better. Anything that they see today is just edema. So when they say, oh, you fixed my lines, quickly tell them, nope, you've got some edema, there's just a little bit of swelling in that upper lip. It's going to deflate. Don't hate me when it deflates, because it's supposed to, but over the next 3 to 6 months, we've just kicked your body into its natural wound healing response, and the neocollagenesis will start to take place, and you'll start to see those results really 3 months out, and really see the more of an end result about 6 months out. You can repeat this treatment as necessary if a patient feels like you need to go more aggressive or you want to do it again. You could do that, but allow the body to heal. And it depends on how aggressively you perform this treatment, that if you did a vanity peel on them, you could repeat it in 2 weeks. If you did full field ablation, give that 3 to 6 months. You don't want to go back in there and do a repeat aggressive treatment, because our body relies on its natural wound healing response. And to a minor injury, it's just like going to the gym. When you go to the gym, you break down your muscles, you make little micro tears within the muscles, and then you give it food and rest, and your body will repair those muscles stronger than they were before. Well, what happens if you go in and you just absolutely tear out your muscle, and then you go back the next day and you work that same muscle again? Your body's going to create scar tissue. In lieu of the springy, boingy, healthy collagen that we want, you wind up with the bad collagen. So we don't want to get greedy with CO2. CO2 is a very tried and true and tested technology. It's something that works really, really well, and we want to give it its chance to do what it's supposed to do, and just please respect that the technology that you're performing.
Yeah, I always say, I tell my patients, don't love it or hate it for 6 months. Hands down, don't love it or hate it for 6 months. Really, we want to make sure that we are doing that pre-education before, I think, and helping them get to manage their expectations, if that makes sense. Both pre and post, managing their expectations is hands down going to give you a better outcome for them. So.
That's great.
Sorry, would you mind explaining one more time the two different things that are happening when you go high energy at 3% first for burial, and then low energy at high density afterwards?
Great question, and people are going to have, your doctors will have that same question. That with the 120 micron spot size, we're drilling through the dermal epidermal junction deep into the dermal tissue to lay down fractional CO2 ablation into the deep dermal tissue. We're going hundreds of microns deep. In fact, you could go to settings that would go millimeters deep. It's probably not necessary. But we're going hundreds of microns deep into the dermal tissue. Well, one rule of thumb that we always need to remember is that you never want to pass through the dermal epidermal junction with a density that's effectively to the tissue greater than 20-25%. If you do so, what's going to wind up happening is you're going to destroy a preponderance of melanocytes. Melanocytes make melanosomes, and those melanocytes live right there at the dermal epidermal junction. And so if you go through the dermal epidermal junction, let's say with full field ablation, you're going to wind up with hypopigmentation. Dr. Chuck will remember probably from residency or maybe even earlier, we used to do CO2s all over the full face with this full field ablation, and the doctors would always work, quote unquote, to the chamois. And he's smiling and laughing going, yeah, I remember that, but we don't want to go there. And now that I just said what I said about if you pass through the dermal epidermal junction, which is the thickness of a sheet of paper, so if you're going deeper than the thickness of a sheet of paper, which is essentially 100 microns, if you're going deeper than that into the tissue, you're going to wind up with hypopigmentation if you have too high of a density. So anytime that we're going through the dermal epidermal junction into the dermal tissue, into the, more importantly, the deep dermal tissue to activate neocollagenesis with deep fractional ablation, we need for that density to be low. So that's why I like something in that 1 to 3 or even 3 to 5%.
Yeah, I've never gone above 5 actually.
Bingo. That's, yeah, there's no reason to go high density, because that's where you could wind up with your body building scar tissue as a response to too aggressive of an injury. So the first pass, if doing perioral rhytids, would be using your 120 micron spot size at a high energy to drill deep into the tissue. And you could just pass over the entire area, or some people will take a gloved hand, open up those deep rhytids to kind of give them a better view of the whole thing, and then just treat the entire area. And then the second pass is the 350 micron spot size. This is your resurfacing pass. And I think that's the word that we should probably use when we talk about the 350 micron spot. Is the 120 is for deep fractional ablation, or even microablation on the epidermis, and then the 350 micron spot size is used for resurfacing. This is the one that's going to completely resurface the epidermis, that you're taking off whatever density you applied to it. If you put 10% density, and that's roughly 25% of the surface area, 25% of the skin is going to completely come off. You vaporized it, and your body's going to repair it by creating new healthy skin. You get this baby skin in a couple weeks. It's beautiful. But when you go on up into the 50%, 75%, or even 100% coverage on the skin, which would be 41% on the screen, that's where you get all new, fresh baby skin. And in 2 weeks, they're telling you how amazing their skin looks and beautiful. And kind of like Susan, it's like, yeah, you get the immediate gratification of the resurfacing pass, but you're also getting the benefit of that heat that went down from that full field ablation into the deep dermal tissue, as well as those microbeams that drilled hundreds of microns deep into the tissue, made an ablative injury, and then also created a thermal footprint in there so that your body's kicking into that natural wound healing response.
So just to make sure I'm understanding what you're saying that first pass is 120 micron spot size, which hits the dermis, and then the second pass is 350, and it's resurfacing. It's like mid-epidermal. It's not going deeper than the epidermis, correct?
Correct. And you can titrate your settings, and this is really where that clinical endpoint comes in. Never just put a setting on and run and gun. Always observe, what does it look like? Is it a crispy white frost, or is it more of a dull gray type of response? And that's going to tell you how deep within the tissue you're going, how intense is your beam hitting. And so you can work with our settings to say, okay, I want to be kind of mid-epidermis versus all the way to the base of the epidermis.
And that has to do with the energy. The lower the energy, more superficial you are.
It actually has to do, strangely enough, with pulse duration.
With pulse duration.
So if
the shorter the pulse duration, the more superficial you are.
Correct.
Okay.
Correct. A longer pulse duration is going to penetrate deeper. So it's not really about the pulse energy or the millijoules as you see in that second box. It's the ratio of your power to your pulse energy. And you'll see directly beneath where it says 30 millijoules, it says 2.0 milliseconds. Because the ratio of power to pulse energy is 2.0, and that is your pulse duration. A longer pulse duration will penetrate deeper into the tissue. So that's probably the most important thing that I can teach today is the relationship of power to energy. And what's really funny is that doctors oftentimes interchange power, energy, and fluence. So I'll be working with the doctor on a M22, and he'll kind of call out to me, hey Cole, will you increase the power by 1 joule? And he actually used 3 different units of measurement there. That power is measured in watts, energy is power with a pulse duration, so power with a time constraint on it, and then fluence is power with a time and space constraint. So energy with a spot size. So power times pulse duration equals your energy, and a shorter pulse duration is safer. That's that edge peel that we talked about before. The pulse duration of an edge pulse is very, very short. You'll see that like at the maximum setting, I think the longest pulse duration would be 0.6 milliseconds or something really, really short. Whereas with the standard mode, we're going to be more like 2 milliseconds at the high end. That would be a fairly aggressive setting. It's not top end by any means, but that's a 2 millisecond pulse duration, which is that's a good resurfacing treatment. I don't like to go too much beyond 2 milliseconds. That once you get too high up in there, the risk is greater for the patient. You're going deeper into the tissue. Susan's smiling. She goes way higher, don't you?
I do, but they're sedated.
Yeah, there we go.
And I think this is something to kind of talk about for just a minute. You can change your settings all throughout the patient's face. Like, I don't usually ever do one setting for the whole face. So, having a conversation with them and be like, what areas bother you? Where is it? Around the mouth? Is it around the eyes? Is it these crow's feet? Is it, periauricular here? What areas? And then I know kind of what areas we want to target. Now, is it laxity that we're treating? Well, then I'm going to use that 120 spot size because I want collagen stimulation. I'm going to go more aggressive on that, but I'm still going to give them a collagen stimulation throughout their whole face, and then I'm going to come through and resurface it like we were talking about. But that resurfacing, I think, is more painful. And I also think that that's where they're going to get a lot more of their downtime. So yeah.
That's right. That's right. The next box is not as useful as it could be, because if it was the fluence of the microbeam, you could use that to kind of adjust your settings, but it's the fluence of the entire area. So you can kind of walk past the fluence. I don't want to give you too many numbers to always be focused on, but the total fluence is actually a calculation of the energy with the spot size. So it's not as important if you're focusing on the power, the pulse energy, and then right beneath that, the pulse duration that's measured in milliseconds. That's really what's going to determine your settings. Everything else is a calculation. Stacking times over on the left-hand side. This was a technology that was invented maybe 20 years ago, to where you could do a scan and then it would go back and do a scan right over the top of it. That you could put multiple pulses on top of one another. I would prefer for you just to grab, choose the correct setting the first time and do it with the stack of 0. The stacking times are available to you. It's just not, we're not going to give you a treatment guideline that's going to tell you when to use that. But it is available to you to go to more aggressive treatments, and it allows for a little bit of a thermal relaxation time between the pulses. But one challenge with the stack is that you create char with the initial pulse, and then your second pulse is not going to penetrate through that char, so you create a lot more of that collateral damage, that heat that we talk about, that we kind of want to minimize. So a dermatologist like Dr. Choak may come up with the reason why he wants to create char and he wants to create some additional heat, but it's not something you guys are going to be faced with on a regular basis. And then over kind of towards the center of the screen is a shot interval. Right now, do you see how that's grayed out? That's because we have auto mode off. So shot interval is really the delay between your scans. So right now it's that's grayed out. So what this screen tells me is that if I stepped on and held the foot pedal down, it would scan one time and only one time, never again. I would have to come off of the foot pedal completely, step on the foot pedal again, and it'll now do a second scan and nothing else. That's the standard delivery. Now, when you're first learning and I hand you the handpiece and your hand's shaking because you don't know what's about to happen, leave auto off, because you want to just focus on what's happening, allow people to see exactly what they're going to do. Also, here's a trick. Never have your customer who's being trained on a CO2 laser make their first scan ever on a live human being. Grab a glove box, grab anything. Yeah, People Magazine, it doesn't matter. Grab something so that their first scan ever is on an inanimate object, that no harm, no foul. And so that way that hand calms way down, and do it not in auto mode, so they're not afraid of how fast they have to move it over. So do it in auto mode off, then step on, hold the foot pedal down, it scans one time, they can see the full duration of the scan, because if you come off halfway through that scan, guess what? It doesn't scan the entire surface. So it's really important that they see and experience what a scan should look like, and then they can move the aiming beam over and they see how the red line now sits right there at the edge of the previous scan, and they can scan again and get used to doing that. And maybe they start doing the treatment in standard mode, and halfway through you say, would you like to try a repeat? And that, in that case, you hit the auto button and you can change your shot interval. My comfort zone is about 0.8. Susan's probably faster. What do you like?
I actually do moving mode more than
Oh, okay. Well, we'll talk about moving in just a second.
Yeah.
So, yeah,
But yeah, it's probably 0.8.
Yeah, 0.8.
Yeah.
Yeah, 0.8, because you want to get it right. That if you overlap with the CO2, what's going to wind up happening is you've doubled the density. And remember in the beginning I said that density equals downtime. Well, if you double the density, you're doubling the downtime in that one little overlap area. So I've seen it before where patients have, a week out or 10 days out, they've got little L-shaped red spots on their face. And, it's nothing wrong with your laser. That was you. You overlapped your scans, and so you created either little bricks of double the density, or sometimes a little L if it was a brick and then slightly over. So we want to lay our scans adjacent to one another. And so slow down that repeat mode until you're comfortable with being able to get completely in a position once you start that scan. If you start the scan and realize even as you're going that it's not right, come off the foot pedal and the scan will stop immediately, and reposition yourself appropriately, and then step on the foot pedal again to start the scan all over again. But you can stop a scan mid-scan. You lift your foot pedal or foot off the foot pedal, and that scan will stop immediately. And then make sure your placement is correct. I may as well address moving while Susan's brought it up. So probably my favorite thing about the Edge, entirely, and Susan's nodding, is moving mode. This is something that is fairly unique. It's utilizing that scatter delivery that we talked about before. That's kind of like raindrops falling down. Like they're coming down not in a straight line. They're coming down kind of around the area, and by starting with that pulse delivery that's sort of randomized, you can then press the moving button, and with certain settings, you can just start moving the handpiece. And now you are an artist, and this is your paintbrush. This is so cool because you are entirely in control of what the density may be for the patient. And remember, density equals downtime. And I'm going to say that 100 times because I want you all to remember density equals downtime. And so if you move your hand quickly, they're going to have a low downtime procedure. If you move your hand slower, they're going to have a higher downtime procedure. But this is my absolute preferred method of any edge peel or vanity peel. These are meant to be quick and easy treatments. So if you can do an edge peel or a vanity peel in 90 seconds, why not? You know, they get the patient through it. They'd rather have it done and move on with their lives than for you to stamp every individual one of these. Now, when you first start out, it's a good idea to do them stamped because it helps you to understand artistically what you want to see. Because you can see what 3% density looks like on the skin, because when you do moving mode, it's all about artistically how does it match up to what you would have done had you stamped it. So what we'll do, sometimes we'll take a tongue blade and we'll do stamped 3% down the tongue blade, or 1%, whatever setting you're going to want to use for your treatment, and we'll stamp that on a tongue blade, put that tongue blade right next to the patient's head. So then when you start with your moving delivery, you want to mimic what you see over there on that tongue blade. It should be the same density because density equals downtime. So it should look the same, and your energy doesn't change. Your energy is still going to the same depth of penetration. So if you happen to move too slowly in an area, all you did was you doubled the downtime or changed the downtime. You affected the downtime, which would also affect the results, because the beautiful thing about it is the high density treatments get great results. Yeah. Where you don't ever want to do a moving is for deep fractional ablation. That's not a good time to do moving. Or if you've already got a high density set on your screen, like that wouldn't make a whole lot of sense. But the deep fractional ablation should always be stamped, because we don't want those microbeams going in diagonally as you move along. We want them to go in straight down deep into the tissue and be precise. The density should be absolutely precise, because if you start moving it, it may be 1% in one place and 20% in another, because you kind of slow down your hand or you rounded a corner or something like that. So deep fractional ablation should always be stamped. Moving or anything more aggressive should be stamped, in my opinion. Susan's an expert, so she can do it however she wants to. But for these light treatments, it's such a game changer for an office to figure out how to do that in motion, because now it means that, let's say, patient comes in for injectables and they're arguing with you over the price of Botox per unit. And as soon as they start that conversation, I get the roll of the eyes right now. They start this conversation over the price per unit of Botox and all this kind of stuff. Well, instead of hyperfixating on how to sell against the day spa down the street, why don't you go into say, hey, the hottest thing we've got right now is this edge peel or this vanity peel that we do. It's a low downtime procedure, typically just a day or two of redness. You have a light peel that your skin will exfoliate a couple of days later, and then in 2 or 3 weeks, your skin just looks glassy. Your body's kicked into its natural wound healing response, and your skin looks better. We typically do it in a series, but if you want today, why don't we do just a half price vanity peel for you in addition to your Botox? Now the conversation's away from talking about the cost per unit of Botox and back to getting the results they want. You're introducing them to something that's brand new and exciting, and you want to do more often, and all that it took from you was 90 seconds of your life. The laser boots up really quickly. You might use a Zimmer. I like to use a Zimmer in conjunction with these low downtime procedures because it means you don't have to wait for numbing cream. That with good technique, good preparation for the patient, you could hypothetically do an edge peel or a vanity peel with just a Zimmer. Do you do it that way, Susan, or do you add numbing cream just for comfort?
So it depends on the patient. Most of our patients want more aggressive treatment.
Yeah.
I don't actually do a lot of the vanity pills, so.
Oh, you know what? Every office is different. I've got some offices that do vanity peels all day, every day. Susan's plastic surgery office, right? I mean, why do people go to a plastic surgery office? It's not for a buffing and a polishing, but the machine can do everything. And that's the beauty of it. Dr. Choak's nodding along going, yeah, I see a place for both of these. That, the challenge is very oftentimes offices will buy an aggressive procedure and then they try that one-size-fits-all type of approach to the patient. So you're telling your patient, hey, I've got this great laser, it's 7 days of downtime, look at the results. And patient's like, yeah, I don't want 7 days of downtime. Well, with this, you could say, okay, well, with my density, I can dial in the downtime. So if I wanted to, I could affect the settings and have you a 5-day downtime or a 3-day downtime, or even I could just do a vanity peel to introduce you to what is ablative resurfacing and help you to kind of get a toe in the water to really understand what that would be, because that secret sauce is going to make them want more. That you introduce the ability to give somebody a refresh on their skin, and all of a sudden they start staring at every little wrinkle and bump and brown spot and saying, well, I want to do more. I like what it did, but I want more. And that's where a practitioner that has multiple tools within the shed, you can look and say, well, hey, let's address the brown spots with an IPL. Let's go ahead and knock out these vascular lesions. Not the same day as the CO2, but we can do all those things together. I would not be opposed to doing a spot treatment of isolated lentigines with an IPL or a 532 or something along those lines, same day as the CO2.
We do our BBL heroic on the same day as the CO2.
Yep.
But
yep.
not vascular.
Well, so the vascular you're getting with like a BBL is fine, but if it's something more aggressive that's not going to respond to an IPL anyway, and you're needing to whip out an XLV or something like that, I wouldn't do those the same day because you get a lot of heat. You're hyper heating a vessel in the dermis to 80 degrees Celsius, and that heat's got to go somewhere. If you then come back over the top of it with CO2 to 100 degrees Celsius, it's going to compound the damage. And a lot of times where people will have complications is when they start adding in multiple things, and they'll add in additional technologies that didn't necessarily have to be same day. So if it's larger vessels or anything on the face, maybe give it a week or two between those treatments. If it's just an IPL, like she said, you can do that IPL initially and then go right back over the top of it with the CO2. And when the CO2 flakes off, when the skin sheds, so does those coffee grounds. It's a very cool way to do that. Very modern approach to it. So we talked about auto, we talked about moving. Right at the top of the screen, towards the top, you see where it says standard and it's green right now. Well, if you touch that, it will cycle through the different modes that we talked about before, and you want that to be scatter. In fact, if you just had that scatter every single time, that would be great. And then if you move over, you touch the triangle, it would then change the shape to a triangle, and you could touch your way through the different modes of that. Same thing with the circle. That's just how that's going to be set up. You do have the ability to save favorites at the bottom. That's kind of cool if there's just a setting like Vanity Peel. It's the same setting on every patient just about. You may make a little bit of a change. You can save those at the bottom. And then your standby button on the far right. I didn't talk about the up, down, left, right joystick controls right there. But right in the center of that control, you can see that there's a square. That's indicating to me that we're working with a square right now. And I can hit the up button to increase the height of that square. I can hit the right plus button and I can increase the width of that square. So I can make it a rectangle, I can make it a square, I can change the appearance of that, and all of this in real time will be changing it with your scanner that you're holding in your handpiece on the scan, that you can see the changes that are being made, so that you can determine what spot size you want or what scan size you want to use. But most commonly, Susan agreed earlier, 15 by 15 is really kind of the go-to. And when you get to smaller areas, you can shrink down one or both of the dimensions of that. You can make it a rectangle if you prefer, or you can make it just a smaller square if you're trying to get into really isolated areas. But we're going to show you a trick with the tongue blade that will be much faster. And very few people do this, and I think that it's one of those that as soon as you see this done, you kind of slap the forehead and be like, yes, I should have been doing that all along. That'll really speed up my treatments, because then you're not going back and forth to machines. They are even on the Edge 1 where you've got the handpiece controlled, where you're changing your shape and size. The tongue blade trick is going to be very beneficial in training today. Our slides have paused. Dr. Choak, any questions?
Yeah.
He's written down tons.
When the engineers were designing the laser, what application did they have in mind for that standard beam?
For the standard beam profile, for the standard scan?
Yeah.
It's traditionally there. That is how old school scanners used to work before one of my friends invented that algorithm, of placing the spots as far apart from one another. So it's to give people the versatility. Companies like JASIS have a philosophy: is if it exists, we want to offer it. It's like if that pattern exists, let's put it on the scanner, make it available to it, because somebody may want that. But
Gotcha.
in actual practice, and today with the modern CO2 like the Edge 1, let's just use that scatter mode. That the scatter is going to be the best and the safest. It becomes less of a benefit the tighter your density is. So the higher the density number, the tighter your dots are, the less of a benefit you get from that scatter distribution. But that's really what I would prefer to use every time. Susan's nodding. I think that Dr. Choak will do that in his own practice. But those other modes are available just in case you can come up with a reason that you would prefer to have that. You're old school, and that's what you want your scanner to look like. But
OCD.
Yeah. But quite frankly, when you get done with it, if you're using, let's say, standard mode, when you get done, there are straight lines all over this patient's face.
And they look like tracks.
Yeah. It's perfectly, and if there's a tiny little gap, you can see exactly where that tiny little gap was, because those little white dots now have a little gap in there. Whereas the scatter mode offsets the edges. It frays those edges so that you're able to sort of like interdigitate the edges, and it's much more forgiving, because you're okay right here, and you can't see I'm talking with my hands like I normally do, but you're okay here, you're okay here, you're okay, and it's much more forgiving, and so you can just kind of blend those edges a lot better. The outline of the cheek, the forehead, etc. There's no real straight line right there, and if there is, and you want that to go away, let's say there's just like a weird little crest in their hairline, you can always start the scan and then flick it up into the hair. I said this earlier, that you just kind of step on the foot pedal, and as it starts to scan, flick your handpiece up into the hair. Maybe we'll do this today, so that it really kind of disperses those micro dots up into the hairline, and there's less of a line of demarcation.
So
because
it more feathers it.
Yeah.
Feathers and blends.
Yeah, I'm not a fan. Some people want to lay a CO2 sideways, like at an angle. You can do that, but what ends up happening is the close edge gets the correct fluence, the far edge doesn't get the right fluence. So you could do that for one pass, but you can't do, like, a lot of times people want to do like a second pass. It's like, nope, you're done. Like, that's it. That's all you get. Because the far ones may actually come out as the beam travels through space, it enlarges. And when a beam enlarges, that means that the fluence of that beam is less, and so it becomes subablative. So angling the handpiece at like a jawline doesn't do what you want it to do, because the beam is not going to stay collimated. It's going to disperse and enlarge, and so you lose your fluence. So a better way to do jaw lines to not have a line of demarcation is to kind of do that little flick, or to do your stamp pattern to the jaw, or to almost the jawline, and then go back with an in motion to where it's just really irregular looking at the border.
Yeah, sometimes I use the feathering though. Like I actually use it to my benefit. Like if I'm doing like medial right where their nose is. Does that make sense? I can't get the tip right in there, and I also don't want it to be as aggressive there. So I actually use that feathering pattern to my benefit right there. So, yeah.
That is right. Surgical mode. We're not going to dwell too much on surgical, but like I said, most people are going to use that continuous way because it's easy, it's predictable. You know exactly what you're getting. It's a lightsaber in your hands, and you are now the artist. We don't teach surgeries. We don't teach people how to do blepharoplasty. It is a incisional tool that they will practice on their own, and they need to be able to do the surgical procedures already. Again, we do not teach any surgical procedures. We teach how to move a handpiece. We teach how to connect a handpiece. So if they are interested in using the surgical applications of the Edge 1, your responsibility would be to show them how to connect the handpiece, which we can do later on, and how to put the right settings on the screen. And then there are some settings within the guidelines that will tell you how to do that, where you want to be. But for the most part, you're looking at your clinical endpoint. You're watching your hand. This is nothing but a paintbrush, and you are the artist. So the difference between continuous wave is we talk about that ablation to coagulation ratio. With continuous wave, there is tons of coag. There's lots of heat, but doctors will use that to their advantage. So when they're doing a surgical application with continuous wave, it's coagulating those blood vessels. So it's slowing down the bleeding that's going to happen when you do a procedure like this. So if you're doing rhinophyma or something like that, you're coagulating those vessels as you move with the continuous wave. Whereas the edge pulse, you can see how the ablation is that center core that dug deep down into the dermal tissue, and then the thermal footprint that's around that is very minimal. It's just enough to cauterize and stop the bleeding from that. So those are kind of on the opposite end of the spectrum from one another. And here it is actually on the skin, and again you can see how a high energy setting with the standard pulse is going to have a nice carbonization zone around it. That's why the energy density, or excuse me, the density on the screen doesn't match what's on the body. Is that the density on the screen matches that inner core that you see, and then depending upon your settings is how big that carbonization zone is going to be. And if you're using the edge pulse, you're going to have your pulse and then a very small area of coag that surrounds that ablated core.
When I talk to patients, I tell them it's like creating little micro channels
Yeah.
in the skin, so they understand that a little better.
Yeah, that's right. Do you ever do topical distribution of like PRP or anything like that over the top of CO2?
Yes, and we also do exosomes.
Okay.
So, yep,
All right.
afterwards.
Not anything we teach. Those aren't things that we do, but it's not a subject that that's off limits to discuss with a provider based on your own education, your own experience. Those are commonly done in burn centers or when treating scars. I've known people to topically distribute Kenalog. That's another application that you now have these microchannels into the tissue that you can topically drizzle the Kenalog over the top of that, and then almost massage that into those microchannels. This is really about the distribution. I know exactly what device did that one on the left, and it's one that I don't recommend. You can see, first of all, the small scan size. The smaller the scan size is, the harder it's going to be to cover the surface area without having some weird spots like that. The larger 15 by 15 spot that you have available to you on the edge is going to really help with that, first of all. And then second of all, if you're in that scatter mode, it really helps to blend those in. And so you see how nice and just homogeneous the erythema is across the face. Patient really likes this. Patient's very happy with this distribution. And so that's really what you're looking for, is just an even distribution over the face. If there is something that doesn't look right, if you missed a gap or there's a white rectangle within there, you can always go back in, lay down your tongue blade, and just fill that white gap in, and really easy to cover the whole surface area. Actually, go back one, because I worked with Susan half a year ago, and we talked about the wiggle. The wiggle is one of my favorite things to do, and that's where if you just need to fill something in, you just put the scanner right on top of that spot, and instead of being stamped where it's doubling the density of everything, you just kind of move it in it's a single scan, but you just move the handpiece around a little bit. It's called the wiggle, and the wiggle will help to fill in that gap without necessarily doubling the density of that whole area.
That's probably what I do,
Yeah.
actually, more is the wiggle, especially if it's just one pulse,
Yeah,
That's what I do.
easy. And this should be easy and fun. That's really the whole idea of this, is that you've got a versatile tool that can do so many different things, and really the more you learn about the system, the more experience that you have, the more you can do with it. And the wiggle's an easy little trick. Let's skip past this because this will all be in the documentation, but you're going to have various access to charts with settings, and we actually are working on a project right now that's going to create some new standardized settings from the users themselves. And with that, we're going to have tips and tricks as part of like an editorial guideline. So all the doctors will talk about, hey, when I do vanity peels, these are my concerns, or I will always go to an edge peel for treating a Fitzpatrick 4 or 5, and here's why, or here are the considerations that I have when treating patients with this or that condition. So we'll skip past the treatment settings for right now. Before and after photos, we kind of know what we're getting with the CO2. We are ablating the tissue, so this is meant to be a downtime procedure. This is not a laser genesis where they walk out of there looking better than they looked when they walked in. Like, they should have char on their face. They should have the little white dots, and then typically we're simply going to topically apply something as minimal as Aquaphor, right? Aquaphor would kind of be the bare minimum. Then you could move into some of these products that a lot of the high-end offices will carry products like Bio2 or the post-ablative kits that are probably important if you're doing the more aggressive treatments, because those post-ablative kits will offer not just a balm that will help the skin heal more rapidly than it would have using Aquaphor, but those post-ablative kits will oftentimes also include a soap that will help to dissolve the proteins of that balm. So when the patient really wants to wash their face and do a vinegar soak and then reapply the balm, the soap will break down the contents of the balm, or the proteins within the balm. And then one kit does like a little spray that'll help to take the redness out. We don't get into recommendations of what to use, but know that there are available to you a lot of post-ablative kits. Make sure that anything you put onto a patient after an ablative procedure specifically says ablative. So we get it every once in a while where an office will put on post-laser cream. Post-laser cream was not meant to go into the body. Its ingredients aren't sterile. It was not designed to go inside of the body. And so what winds up happening is you have a secondary dermatitis, their skin's reaction to that, that cream going inside of the body. So that's treated as secondary to the laser procedure. It had nothing to do with the laser. The laser simply made the holes, made the portal of entry. So, we oftentimes just talk about Aquaphor because it's easy to obtain. Everybody's got access to it. If you don't have it there, you can send somebody down to Walgreens right now to get some. And we want to do it as a thin layer, never a thick globby layer. Thick globby layer is going to create mealy cysts. And Susan's like, you know what happened when patient comes in with little white dots or little white mealy cysts under their eyes or on their cheeks. It was they were over applying the topical. So it should just be a thin layer of Aquaphor, whatever topical you're using. Use to that manufacturer specifications that it needs to be intended for ablative procedures or something as simple as Aquaphor and Vaseline. But it's really important that you can distinguish between something that's intended to go inside the body and things that are meant for external lotion or post-IPL, standard treatments like that. Are you willing to talk about what you guys use?
Sure.
Okay.
Yeah. So we actually do a pre-treatment too. So our patients pre-treat, and I give them a full page on what they need to do starting 2 weeks before if it's a more aggressive treatment. We have found that they have less downtime and they have better results. And one of them is actually just simply drinking water.
Yep.
Because this machine targets water. And so if you're a smoker and if you are just chugging down soda, you're actually not going to have as good a result. So if we can hydrate the skin prior, you're going to get better results. We use a specific brand called Elastin Nectar. Elastin Nectar specifically turns over and gets rid of old broken collagen. So what we're doing 2 weeks before is we're starting to have them pre-treat to get rid of their old collagen. So then when we stimulate new collagen, they'll respond better.
Yeah.
The other thing that we do with them is start doing, especially if they don't exfoliate yet, because I want to give them a more aggressive treatment. Let's already start every other day getting rid of that top layer of skin that's already there.
Yeah.
We do talk about this is a biostimulator. So I can do a treatment, but what you bring to the table and your before and after care will affect your results. So we do a lot of that. After our treatments, usually they go home with just a hydrating mask. I've put on nectar directly onto the skin after I do a Silvadene spray. Silvadene is an anti-burn, antibacterial, antifungal. So I'm going to quickly spray their skin off, and then I'm going to put on another layer of nectar, and then I'm going to take, we call it Soothe and Protect Balm. It's specific from Alastin. It's kind of in a package deal. When they get a CO2, they get these products with it, if that makes sense. So I'll put the nectar on, and then I'll take the balm. And a treatment to think about with balms is they're really, really, like you said, dense, right? Aquaphor is really dense. So my trick is put a little on your hand and rub it between your fingers and heat it up before you put it on your face. You're gonna put a less product on your face, and it won't be gloppy. If it's gloppy, you're gonna get a breakout, and it's actually gonna contain the heat, and I think you're gonna increase your risk of a burn too.
Yep.
So we do that for about 3 to 4 days, actually every day. They clean their skin with a gentle cleanser. They spray it with a kind of like a Puricin spray, and then they'll reapply nectar and then reapply the balm. So
Excellent.
yeah.
Do you guys do vinegar soaks as well? Do you advise that?
So we were doing vinegar soaks, but the response that we got back from patients was that it hurt so bad. And so we've actually stopped doing vinegar soaks. Instead, we just do cool compresses.
Okay.
Just water and cool compresses. One of our favorite things are just handheld fans, and also like a jade roller that you keep in the fridge.
Yeah.
So jade rollers, just kind of soothing, because really after, depending on how aggressive you go, but your second stage is actually going to be like itchy, like super, super itchy skin, and that's sloughing off. And you hands down do not want your patients to take any NSAIDs, any Benadryl, any like allergy medicine. That actually stops what's called neocollagenesis, and we don't want that. That's the purpose of this, is to stimulate collagen. And so by taking those, you'll stop that process. And so we try to just help our patients have some autonomy in what their results are going to be by, hey, try this jade roller, have these vinegar soaks, and they tolerate it pretty well.
That's great.
So yeah.
That's great. Go ahead. So in summary, we talked about the edge pulse, the moving mode, the scatter delivery, micro resurfacing, how density equals downtime. Density is going to affect the comfort of the patient. Really there's a lot of flexibility within the system, and once you see these live treatments shortly, you'll really get a sense of how versatile this tool is. The automatic detection of the tip, the various beam patterns, lots of versatile functions within this system that make this a great tool for any aesthetic practice, whether this is your only laser or this is the latest laser. That this is going to complement things that they already have within their practice. It's going to open up all sorts of possibilities to where so many of the patients that walk through your door have something that can be addressed by this system. And for that, we're really proud of this system, and we're glad of what we can achieve with it.
So we can let them know to take a break, and we'll be
And
back on at 1 o'clock.
we are going to take a break, and we'll be back with everyone at 1 o'clock.
Hi, I have Tess here. She is looking for kind of a really light, just gentle, what we would call a vanity peel. There's a couple different ways to do this treatment. You can do it with the 120, you could do it with the 350, and then you can also do it with that wattage, and it would be under that edge pulse.
that Cole was kind of talking about. So it's kind of careful. What we want to do is we want to minimize her downtime. So remember, density equals downtime. So we want low density. We want our spot size, if you will, the number of spots in a specific area to be really spread out. So right now, my density is 121 spots, total channels that we're going to be creating on her. She doesn't want a lot of energy. We don't want to like drive it down with our energy to get to a deeper level. We just really want it to be really gentle. Now, the thing that it is we're treating a patient, not a screen. So please make sure you're watching your patient, you're getting to an endpoint, but you're also watching your screen to kind of just guide you on where you're at, but really you treat a patient, not the screen. So she hasn't been cleaned yet, so I'm gonna prep her. Where I work, we use HibaCleanse, so I'm just gonna clean her, sorry. With HibaCleanse, we're gonna do face and neck on her. And remember, this is not like a massively aggressive CO2. This is a gentle, kind of just refreshing, I would say, is kind of more of what I think about this treatment. So yeah, just kind of cleanse her. After this, we use some Puricin to kind of clean her. But, and then our target here is really, really dry skin. So some people actually take pure acetone and actually wipe them with acetone after to make sure that they're really, really dry. So we really want to dry her out because this CO2 laser is attracted to water. So just cleaning. Do you have any allergies to medicine?
No.
Okay, perfect. Have you been out in the sun recently?
No.
Okay, yeah, for my safety, for my patients, I usually have them avoid sun exposure for 2 weeks prior, just to make sure that they don't have any risk of a burn, anything. If they keloid, do easily keloid, which is where you kind of build those scars. That's kind of a contraindication to this. If they've been on Accutane within the last 6 months, that's also a contraindication. Do you have any tattooed brows or lips, any blushing?
Nothing.
So for those specifically, I want to make sure I avoid hitting those because that can kind of alter it. I'm just kind of careful. So she's got a little bit of some veins here, if you can kind of see right here, some little telangiectasias. This machine is not targeting those. That would be more of our like BBL heroics or IPL, something to kind of zap that. But this is gonna just kind of give her like a nice refresh. So gonna put some goggles on. Okay, go ahead and lift up for me. Perfect. That little ponytail. Is that tight? Nope. Okay, lift up one more time. I'm gonna try to tighten that. Sorry, Tess. Make you do like a crunch. All right, there we go. Okay, so we want to, of course, safety is our #1 priority. Some people use intraocular shields. If it was a deeper procedure or a surgical procedure, I would put intraocular shields on so that I could treat her lids. This one I might just kind of move around a little bit to see how it does. I switch my gloves out after I've cleaned, especially after I put in intraocular shields, just to make sure I'm starting with clean gloves and everything. Okay. All right. I personally keep go ahead and lift up for me. This is just a dental bib, and I keep a tongue depressor in my left hand, and I keep a gauze pretty close to me so I can grab what I need depending on my procedure. So we're gonna start kind of in an inconspicuous spot. We're gonna start over here just to see how her skin responds. Again, I'm starting low density, low energy, just to see how her skin responds. She's new to me, so I just wanna make sure more than anything that she's safe. So on my machine, I'm gonna turn my spot size, which is the square of the tracer, I guess.
Is this like the edge peel or vanity peel, or that would be something different?
This is the edge peel, vanity peel, yeah. So
And those are two different things or the same thing?
they're like the same thing. You sure, guys? Okay, let's just see here. So it should show me, if you can see that close, There's a lot of light in here, but you can see this red outline. And I'm gonna make sure that I am in the refresh mode, scatter mode, right there. So I also wanna make sure that my patterns are kind of scattered. I like that better. Again, low density, everything, we're in standby. We're gonna do spot mode here, just because I wanna make sure. 1, 2, 3. So that went really fast, didn't really give me a lot of pulse energy, didn't really do much, so I'm gonna turn up her energy. Okay, so our density is just a little bit more. Okay. Again, just light. 1, 2, 3. You see that? See how it got white and everything like that? So that's kind of what we're looking for. Okay, 1, 2, 3. Boop,
Are you overlapping with these? Or?
I try really hard not to. It doesn't look like I'm overlapping here really at all. I'm kind of trying to line it up really close. Now, this is, for a vanity peel, this is probably just a little too much energy. So again, I was trialing it to see. So I'm actually gonna go down on my pulse energy here. My density is gonna remain the same, but I don't want a massively aggressive treatment on her, if that makes sense. So I'm gonna go back to standby, ready. I'm gonna go beside it so I'm not doubling
You're just looking at how white it is?
Yeah, just kind of looking at my endpoint for what I expect for a vanity peel. So you can kind of see that I'm not, if I was doing more aggressive, I would definitely watch the skin tighten and everything. So, but you can kind of see as best we can here. But it's already red. It already has this white pattern on it.
Yep.
So that's really what we're kind of looking for that vanity peel. How is your pain right now?
It's fine.
Okay, so if it's fine, then I'll just kind of line up right here, do my best to get 1, 2, maybe 3 here. 1, 2, 3.
Do you always use the smoke evacuator?
Pretty much.
Okay.
Yeah. Minor, you probably don't need to for this one, but for our more aggressive treatments, you hands down see like plumes of smoke here. All right, so I got her jawline right here is where I was kind of matching. So faces are very forgiving, necks aren't as forgiving. So we need to be really careful with what we do with her neck. And I always change my settings, especially when I'm doing aggressive treatments. But we can even see now, you can see that first row that I did right here, see how it's a little more red still compared to this as I moved more medial.
Yeah.
So I turned down my energy. So I kept my density the same, still 121 dots, right around there. And then, but I turned down the energy because this is gonna take more than, 2-3 days to really heal, if that makes sense. So I'm gonna follow her jawline. Some people trace it out.
You said 120 dots, what do you mean?
The density.
The density.
Yeah. So I'm specifically, you can see I'm kind of using my tongue depressor because I'm gonna mark out her jawline first. And sometimes I take a pen and like mark out the different regions, but I really just wanted to stay on that jawline, if that makes sense. So yeah, here we go. 1, 2, 3. So in each...
So when the density is 1.8, that's the dots per centimeter?
Yeah, so 1.8, and then I can change it. So depending on how many dots I want per centimeter. Yeah, in each of these little pulses, if that makes sense, there is a specific amount. So only 1.8% of this square, like it's a 15 by 15 millimeter, it has 100 and, see right now I'm at 169 dots, okay? So yeah, she's doing great.
So if you increase the density, you get more dots or less
Correct,
dots?
yeah, you get more. I can show you, yeah. So here, density. So this is gonna be 2.9.
Okay.
I'm gonna put her down. So we're just gonna show everybody this. You have to click it on standby. But here, just watch, okay? 1, 2, so this is almost double what we had before. You see that? So you can see the difference in the dots, the total number of dots.
Because the dot size isn't changing.
Correct,
Gotcha.
the dot size isn't changing. So,
And
yeah.
you notice that the scan took longer.
Yeah.
Yes.
That's why we don't want to go to high density when using the 120 micron spot size, is the scan takes longer to deliver.
Yeah, and I am using the 120, but it's because I'm doing a superficial treatment. If I was going really deep, I would change this, if that makes sense. All right, everybody good? Any questions, concerns? Okay, 1, 2, 3.
So, and I've got here, so I don't want to kind of overlap here for this one and give her a double treatment. So that's why I grab this really quickly, if that makes sense.
Yep.
So I kind of use this as a little guidance for my treatment. Okay, round your eyes a little tender. 1, 2, 3. Good job. 1, 2, 3. Okay. I don't love getting in their hair. I try to avoid it if I can, so I'm going to put this right here. Does that make sense? And so just put it right here. Do you remember when we were talking about that wiggle? That makes sense?
Yeah.
Right? So this is what it is. It's spreading it out. See how I kind of move my handpiece as I was moving it? Just because I didn't want the full density there. I'd already treated her on each side, and I didn't have enough hands to hold the tongue depressor. So I held it on the area that I didn't want to, and then I wiggled it, okay? You can see she's kind of bright. So.
Just spreading the dots out a little bit more with the wiggle.
Yeah. Alrighty, you ready? Okay, we're gonna do around her mouth. So again, I kind of mark out their jawline a little bit here. 1, 2, 3, this is where we left off. And it's okay to ask your patients to move, if that makes sense, like moving them around. How's your pain right now?
It's fine.
It's fine. Can you give me on a scale of 0 to 10 where you're about at?
1.
A 1 out of 10 right here. Go ahead and move just to the left. So here we go. Okay, around her mouth can be a little more painful. A lot of people, we use like a deeper treatment when we're addressing like the rhinids right here. Oh, yeah. One side, then I do another side, okay? I'm gonna take it and push up on my lip, but you're also gonna take your tongue and put it above your teeth. Does that make sense? Yeah. So that allows that to stretch out, and then I don't have to worry necessarily about getting her lip. We don't wanna get her lip. 1, 2, 3. Again, this can be a little painful. I use a hand to kind of separate it and the tool itself to separate. Oh yeah, relax now. Perfect. Oh yeah. So, I'm not perfect, but I try to really line up my, see that, here we go, how I'm doing my lines. Okay, turn this way. Okay, so now I'm gonna do, I did one half of her face, so now I'm gonna do forehead. So I usually do lower face, and then upper face, and then lower face, upper face. So, all right, you ready?
Yep.
So, yeah. So I cover their brows, especially if they're tattooed a little bit or have any inking on it. Just to make sure, just kind of get that covered. I know some people like auto mode. I personally like to have control of the foot pedal, so there we go. So each pulse is me controlling that on the foot pedal. Good. Alrighty, here we go. Okay, so hairline, this is where a little wiggle is going to happen. I'm going to go like that, protect her hairline, just kind of move it just a little bit, kind of fan it and feather it is what I'm doing. Just for the amount of one pulse. So I'm just kind of feathering that in. Now I'm going to move her goggles up. All right, are they still kind of protecting your eyes?
Yes, ma'am.
Okay, so what I'm going to do is I'm going to pull down on her skin. And what she's going to do is make what's called, I call it a mascara face. So you're going to open your mouth really wide and raise your brows. Yep, every woman knows how. It's if we're putting on mascara. So I'm still pulling down. Her eyes are still really protected and just making sure that she can tolerate this. How was your pain there?
It's good.
Okay, good. Okay, now you can relax. I'm going to get this like crow's feet here. Good job. Okay, now I'm going to finish her forehead and then I come back to her nose and her lids, if that makes sense. So, yeah. Alrighty, you ready?
And do you ever go like a little denser even on a treatment like this?
It depends on how much downtime.
11 lines?
You
know
can,
what I
for
mean?
sure. You can for sure. For her specifically, she just wanted more of a vanity pill, so I'm just being a little bit, absolutely, I hands down do that.
And even for like these lines, I go
Yeah.
very deep for those. I usually go a lot deeper under the eyes. I'll do above her brow. Different areas for the necklace lines, I will do that specifically.
understand.
Yeah.
Do you want me to put that back on?
Okay, turn your head to the right. Perfect. Okay. Again, we're just gonna kind of outline her brows, just make sure she's good, safe. We have a lot of people here who have like tattooed brows, just to kind of give them a little pigment, so I just want to protect that. All right, how's your pain? Still good?
Yeah.
Okay. All right, just want to always check in with them, make sure I'm watching the skin. Perfect. I'm gonna go right here. Perfect. Okay, I'm gonna move this down just a smidge so I get this area. Okay, I'm gonna bring this up.
And Susan, before you
Yeah.
do the whole other side of the
Oh.
face, do you mind if we
Sure,
switch?
absolutely.
Amazing.
Yeah. Sorry, habit.
No, no, that's all right.
Okay, here we go.
Let's just turn this way.
Yeah, so I did just right here. You can kind of see where those lines are.
Yes.
Yeah.
Here you do like a little wiggle right there.
Yeah. Mm-hmm. Yep. Yeah. It's just spreading that out a little bit. And then I don't know if you heard me, I said do a mascara face. And so what I have her do is open your mouth really wide and raise her brows, and then you're gonna pull down on this
Gotcha.
skin. Yeah, to do her under eyes. And if you say a mascara face, most women actually know what you're talking about. So yeah.
You okay?
That area is a little ouchy too. Yeah. Good. Nice.
And you do like a little wiggle here too?
I
Or
would
you just-
I would just do her nose and line it straight up to her. Yeah.
Do you have the,
So I would just tongue depress her. Yeah. Right there.
What Susan's showing is that the nose is very flexible and pliable,
Yeah.
so you just kind of push on
So you
the-
just push on it with the handle of it. There you go.
that
And you
okay?
get more smoke. Yep, when you laser on wood, so that's
Ah, okay.
normal. So just yeah, no, that's normal. Yeah. So I would do her face
And then go back
and
up
then
to the
go
nose.
back to her
Gotcha.
nose and her upper lids is how I do it. I just put my most awkward, like my, how do I describe it? The most the part I have to manipulate the most, right? Nose and eyes. I save that for last. So you don't have to if you have a rhythm or reason. Do you?
You know, Susan and I are talking back and forth. I think you can hear me through the mic. One method that I often teach is to do the jawline first, so you can get a really nice straight line across the jawline. Then I'll do under the eyes and kind of trace across underneath that goggle strap. Go under the eyes and then down the nasal labial fold, and then work vertically up and
So-
down to fill in the
Yeah.
space between those two lines. And then you go back and you take that strap and you tuck it under the ear. So right now it's over the ear. Bring the strap to under the ear, and now you're able to do the temples and go now just above the eyebrow. Do your first row right above the eyebrow. To your next right below the hairline, and then fill in that space. So that way you're able to run and gun a little bit more, and the edges have already been really designed for you, and all you're doing is filling in the gaps in between.
Yeah, I love how it kind of leaves like a pattern too. So if you see an area where you're like, oh, I need to.
Good. I'm just going to turn your face this way just a little bit. Right over there, right?
Yeah, I would put this right here just in case. Does that make sense? So,
Yes.
Yeah, so now go. Yep. I use that to protect the opposite eye because I don't know if I'm going to have any beams, if you will, like
Yeah,
kind of
100%.
spray. So I always protect it just in case. Even if they have goggles on, I'm like, might as well.
Right.
Yep. So I think we just need a little bit here. If you can see my line right here.
Yes.
There. And then we can do neck. And next, I just kind of like mark out, like I do a straight line straight down, and that way I get each quadrant.
Great. And did you do her this side of the neck
Yep.
yet?
I haven't done her neck yet at all.
Oh, okay.
So.
And are you going to change the settings at all for neck? Or?
I probably turn down the pulse energy just a little bit. Necks aren't as forgiving. Yep. So just go down in energy. I think yep. Let's try that. So what we're trying to do is just give it a little less energy because their necks aren't as forgiving, if that makes sense. Like the downtime can be a little longer. So yeah. And this I like actually doing.
Are you going from here?
I actually do
front?
hairline to hairline.
Hairline to hairline.
Because if you think about the vectors that pull, women need to pull further back, and so do men. So if we can
Right.
get this hairline right up to it, you're going to get a better pull and a better lift and tighten.
All right, you let me know how this feels, okay?
Okay.
Is that all right?
Yep, it's fine.
You think we could switch over to moving, maybe?
Yeah, this is what I was going to say. This is a great time to just click moving and then standby, and then you just kind of make a line. Now remember, however fast you move your hand is how much dense. You are controlling the density right now. Okay, so you don't have to go like
So it doesn't go pulse by pulse?
Correct. It goes bzzz
okay.
the whole way. So you control it. But it's great for neck, so it's okay. Yeah, you can kind of see that. Okay, keep it as close as you can to the skin. It doesn't have to be touching the skin because it kind of drags a little bit, but you can feel that. Yeah, just kind of serpentine up and down.
Is this too fast, too
No,
slow?
I think it was pretty good. So just look, if you're concerned, look at where we've treated already, okay? So you can see her spot. So it was probably a little dense, right? So that just
maybe we
means
could-
speed up your hand.
Speed up my hand.
Yeah. Yep, stand by. Yeah.
Better?
Better, yeah. Look at it, yeah. So it looks better, right? It was a little more dense here,
Yeah.
so it looks better. So you can always just put one spot size on her. Yeah. There you go. Yeah. And then just say, hey, move your neck for me and put your chin up to the
Yes.
ceiling, right?
Perfect.
She can move for you.
That's right.
Okay, because the handpiece can only turn so much too, so she can move for you. Yeah. So yeah, we did jawline, so you need to make sure that you get to, sometimes I have to stand when I do necks because I can't see, if that makes sense. So there's a lot of movement for me when I do this treatment. And I usually can't see the gauze. Yeah. So yeah,
And
just
turn your
kinda
head this way just a little bit.
Nice. Yeah, I personally do their ears too. I treat their ears too when I do like an aggressive treatment. But yeah, so just you see how much lax skin they have back there and everything.
Yeah.
Turn to your right a little bit more. There you go.
Perfect.
go. And next for me are hairline to hairline and down to the clavicle. So I actually spread it out a little bit onto the clavicle, not just where the submental, which is underneath the chin. So I do hairline to hairline and then under your jawline to your clavicle. So it's a pretty big area.
Moving definitely goes a lot faster.
Yep.
You can see why you use this. But you got to be careful.
Yeah, now have her come back a little bit too, if that makes
Yeah,
sense,
turn this
right?
way just a little
There
bit.
you go. You can see that. And I use my secondary hand a lot to pull, to push, to counter pressure. So that's kind of what I do. Yeah, and you try to make sure that it stays perpendicular, right, to the skin. So when it comes off, you're just minimizing the energy and it's getting not as deep or anything, right? Which
Right.
is okay because we're doing a vanity peel. But when we're doing those other ones, you know, we want to just make sure. Tess is doing great here.
Amazing.
Yeah. All right, so you see how it's a little not red here? So I can see it might
Yes.
need a little here. And then this whole submental region, we didn't get that, I think. So just kind of looking at that. Yep. There we go. Yeah, good job. Yeah, just a little bit. And this is where if you want, you can use the tongue depressor or you can use the change the size. And you change the size by push the type by pushing that. That changes your size of the square, and then the
Oh
other
no,
one.
it looks like this is.
Yep, it's changing the size, but it will change the density.
Okay.
So that naturally happens. I was at 15 by 15. Yep. So yeah.
Okay. Anything you think we missed, Susan?
Oh, I think she looks pretty good.
Yeah, I think she
She's a
looks
little red.
great.
I think she needs one right here. Yeah, what do you think? Standing
I think she looks
versus
amazing.
sitting, too?
Yeah, better to stand.
It's really your comfort level.
Yeah.
All right, so now what we want to do is we want to do her upper lids, okay? So what I actually do is I move this down a little bit. I'm actually, our thing at my office flips, so I'm going to have you raise your head up for me. So what I'm going to do is kind of bend this a little bit so we can put this over her nose, right? So, because I still want to protect her eyes, but I want to
Yeah.
move it down. And then what I'm going to do
I see.
is, let me put this under you now. Raise your head up
Maybe
one
we
more
should
time.
just use gauze. Maybe it'd be easier than the
Yeah, that's
eye
all
shield.
right. Well, I'm not going to, yeah, I would just use an eye shield because you're going to pull up.
Ah, gotcha.
Okay, so you really want to pull up, and you can take a tongue depressor and push it on here. And you're only, this is where I change the size of my spot. So
I
I
see.
usually do a 13 by 13 millimeter. But she has pretty beautiful area here. She might be able to fit a 15 by 15. Does that make sense? Everybody's a little
Yes.
bit differently. So what you're going to do is you're going to pull up on this and have her raise her brows too. Does that make sense? So it's a lot of play here.
All right,
Yep,
lift your
and then
brow for
sometimes
me.
I turn that to the side if I don't want this piece in the way of the hand piece. Does that make sense? Like I kind of, you can change it a little bit. Does that make sense?
Yes.
Yeah. So I move it around, make sure that my scan is right where I want it. And then if I'm
that
worried
okay?
about getting on the brow, I use that tongue depressor to cover their brow. Oh. Yeah. Just line it up. Yep, so we still got her eye protection on. You're gonna go more on your brow. You're gonna put more of that on the tongue depressor. There you go, so you don't have to push those goggles out of the way. Does that make sense?
Yes.
Yep, there we go. Perfect. And like we were mentioning earlier, because she has a little bit of deeper lines there, you could change your settings and treat these deeper lines here. This is a thicker area, so of course we can go a lot thicker, but her goal today is a vanity peel. So we'll probably show you that on a different model. Okay, relax your brows, just give yourself a break. You can only hold that position.
That's true.
All right, and then turn that just a little bit. So make sure that she's covered and then pull up on that. Yep. And then any extra, just cover on the wood. Perfect. Perfect. Keep that down. Does that make sense? Because otherwise it
It's
decreases
gonna
your
block
energy.
more.
Yeah. Okay, Good job. And then do right here too. I think we need to get a little closer to her crow's feet there. So this is one of my favorite treatments for like anti-aging. It's definitely like a
Tess, I'm just gonna move
biostimulator.
this just a little bit.
So, you know, we're really just stimulating her body. Like a lot of people are really interested in more natural treatments than just Botox and HA fillers. And this is a great way for that anti-aging process. So yeah, that looks good. It's just like- Good job.
Good.
Great.
Okay, so what I usually do is I usually have like a hypochloric acid or a Puricin right now. I would re-spritz her. Or we have like a Silvadene cream. Or
Silver
here's
gel.
silver gel. We at my office have a silver spray that I spray them with. This is really cooling. How do you feel on a scale of 0 to 10?
About a 3.
About a 3. So at this point, you could turn on the Zimmer, and she could have the Zimmer
A
going.
3 meaning you feel really burning.
3 out of 10.
10 being bad or 10 being good?
10 being hurts really
Yeah.
bad.
Okay, good.
Sorry. Yeah. So she's actually pretty much where I would want her. Now, for most of my patients that do the CO2 laser, I'm going to take these off now. Their pain can last usually the first day. They don't usually need much after the first day, narcotic-wise. Just that first day. Nice. Good. Yeah, I just need a quick little layer of this. A little more. We at my office usually use a nectar afterwards. That is a post-injection, or excuse me, a post-procedure for collagen stimulation. So yeah, make sure we get her up and close here. Any questions, concerns for me, Tess? Okay, her torture's done. I'm gonna switch gloves and put just a touch of Aquaphor on her. Just really want to make sure that she's covered. I use Aquaphor as kind of like a bandage, if that makes sense. So instead of putting a bunch of bandages on your face, we're going to kind of put just a gentle layer on there. So we're going to use a little Aquaphor. I'm going to use a tongue depressor, just scoop some out. So, and Aquaphor is really, really dense. Like if I was just glob this on her skin, it wouldn't move. So what I do, a little trick, is I heat it up in my hands so it's more pliable, and then I just gently put it on. So you don't want it globbed on. You just want a little bit kind of blended on, and it's going to act like a little bandage. But we definitely don't want it blobbed on. That's when you can get a little some milia coming up. It can hold the heat in. So yeah, just kind of spread that all out. Get your ears. And I usually have my patients cleanse and reapply the nectar with the Aquaphor every 4 to 6 hours. So kind of cleansing it for about 3 days, and then they can switch to a different moisturizer. So yeah, what'd you think?
Oh, my face is still numb.
You're
Your face is
glowing.
still numb.
You're
I love
glowing.
that. Alrighty, you
Okay.
are good. Yep.
our edge laser, and she would like a full face and neck. She's been wanting this for how long? A couple years, you told me, right? Yeah, a couple years. So Kim's main concerns are some of our around the mouth, the lines around the mouth, and then around her eyes. You can see some of that. And I'm actually seeing a little bit of laxity right here. And she's got a little bit when she relaxed when she jowls down, she just has a little bit of laxity. And so I love the CO2 because it really like tightens the skin. It happens really slowly, it's over time. It happens over 6 months. So I always tell my patients, don't love it or hate it for 6 months, because that's how long this collagen takes to work and to see full results for it, right? They may see some before, but full results are in 6 months. So we're gonna tighten this skin up. We're gonna kind of see, maybe we can get, if she can tolerate it, some of this contraction, the skin contraction. Now, some of the things we're gonna be, with patients, I'm always, the most concerned about is number one gonna be safety. So what is, again, her safety? Does she have tattooed brows? Do you have tattooed brows? Do you have any eyeliner or blushing on your lips? Nope. Okay, so do you take any, or have you been on Accutane in the last 6 months? No. Okay. Do you do something called keloid, which is where you like scar or anything? Okay. So she does have a tendency to keloid. Do you have, can you show us a keloid that you have, or anything that you have a keloid in?
On my back.
On her back. Okay.
You want to see it?
How bad is it? Like,
It's from a fusion.
oh, it's from a
So
fusion.
it's like down, like, here.
It's from a surgery.
Yeah, from a surgery.
Okay.
But normally, not too bad.
Not too bad. Perfect. Okay, we just want to make sure. We have her using Pronox. Pronox is like laughing gas that helps her just kind of relax, but she stays with me. The best way to use Pronox is to have them take a deep breath and hold it in their lungs for 10 seconds. And then this is patient controlled, so she controls how much Pronox she takes. Sometimes their feet get tingly, sometimes their legs get tingly. You can also do like blocks here. She had a topical numbing on. I used I used Hibiclens first, and now I'm using alcohol to really, really dry her out. Because again, if you remember, that CO2 is attracted to water. So the more hydrated she is, even 2 weeks before starting that hydration process, the better results she's gonna do. Now, looking at her ears, she actually could use a little bit of tightening on her ears too. So I do that also. We'll have her take those out in a minute. Okay, so we're gonna do, our first pass is gonna be for our collagen stimulation. So we're gonna use the 120 spot size. I'm gonna look at my density. So as we learn how dense it is, right? How many dots per square centimeter is gonna be how much downtime she's gonna have. Sorry.
Oh, sorry. I have your glasses
Oh, you
right
got my
over here.
glasses? Perfect, thank you. Thank you. All right, I'm gonna put these on, but we wanna just make sure that our density is okay. So I'm gonna see how she does at a density of 2.5. So that's between 1 and 5, 2.5. So we're halfway there. Dots per centimeter squared are 225. So she's gonna create 225 channels for each one of hers. Now, this is gonna make it so it's a longer duration, okay? Now, pulse energy when we're driving down, that's what the 120 does. It's gonna drive down. We want our pulse energy 60 to 100. So I'm actually moving my pulse energy up. I'm gonna put it at 60. That's our lowest because she's not sedated. So I wanna just make sure she tolerates it okay. So we've got a density of 2.5, a pulse energy of 60, and we're gonna use the spot size, the 120, and we're also gonna make sure my square is at 15 millimeters. So we're gonna have her turn her head. She's with me here. And we're gonna, again, treat over here. Now I expect she's gonna keep me posted if it's painful. It should be a little more painful than our last one, okay? You ready? Okay, this one I'm gonna do in spot. So again, you can kind of see that. Ready? 1, 2, 3. Okay, you can see that. This one, I needed to change it to not on refresh, so I'm gonna change that to scatter. Mine automatically scatters, so this is just Alrighty, stand by. Did you see that? It kind of went this way, guys. Did you see that? Yeah, okay. So she has less here, so I'm actually gonna overlap just a little bit over right here. 1, 2, 3. Did you guys see that skin contract? It literally went all together. It was pretty awesome. How's your pain? Okay. Okay, so this isn't pain-free, but she's gonna do her best to keep taking deep breaths. Okay, and these are the areas that bother me and bother her. So we're gonna try, can you have me a tongue depressor?
Of course.
I'm gonna try really hard to get her to tolerate this procedure. Okay, ready? 1, 2, 3. Okay, so I'm outlining her jawline. Okay, you ready? One more pass here. Good job, just watching that skin contract. So yeah, did you guys see all that? It looks pretty amazing. Okay, so this is gonna pull for her this the preauricular area. Now she's also concerned about her mouth. So I'm spot treating her at this depth and this energy for these. Okay, you ready? Oh, nope, right here. Go back. One more, go back there. Okay, I'm actually gonna take this out of your mouth. Just go ahead and take a big breath. Big breath. Okay, I'm gonna hand it to you because I'm gonna have you take a breath. Okay, relax. Okay, you ready? 1, 2, 3. And watch that skin contract. You can see it just tighten up right as we do this.
So with these high energy, low density areas, you're really
Sorry.
coagulating the dermis. Is that right, Susan?
Yeah, I'm going deeper to stimulate that collagen is really what we're focusing on right now. Can you guys see this contraction that's happening? 1, 2, 3. Oh, sorry. Right, as it pulls. This is another reason why I like the scatter. Go ahead and take a pulse of that. That's totally fine. So I'm focusing on the areas that really bothered her. I'm gonna go back to this side. Okay, we can see this laxity here, right? So again, we're gonna get really tight in here. 1, 2, 3. Watch that contraction kind of come up. 1, 2, 3. Good. Okay, this is kind of this is on the lower end of my energy. A lot of the times if my patients are sedated, I'll put them at 100 energy. She's at 60, okay, which is what the Edge recommends for this. Okay, one more pass. Are you okay? You can take some more puffs of that if you want. 1.
So you're saying that Edge recommends 100 or 60?
So it recommends 60 to 100 for this collagen stimulation. So yeah, there we go. You can kind of see how it's a little tighter there. I'm gonna go right here. Okay, you ready? I'm gonna try to get right here. 1, 2, 3. So, and the smoke comes from lasering. You can see the laser points on my tongue depressor. Okay, so we're gonna go right here. Go ahead and take another little puff of that. So you can see that laxity right here. So that's what we're gonna be targeting. Okay, you ready? 1, 2, 3. Sorry, ouch, ouch, ouch. You're doing great. 1, 2, 3. So you can see I kind of missed a little bit. So what I'm going to do is put my stick right here and go right there. 1, 2, 3. So I lasered mostly on my stick, but then I was able to clear that dot really quickly. So what we've done is we've done a more aggressive treatment on really deep for collagen stimulation right here. Now you can see her kind of scowling, so I know she's kind of uncomfortable. So this area usually needs a little bit. So I'm going to also treat in a triangle or a square here, depending on what she can tolerate at this depth. Then we'll go back and kind of treat around her eyes, really focusing on this collagen stimulation. Then I'll do the whole face with just a lighter setting, but then we'll go and do a third pass with the resurfacing, okay? So we'll just watch, okay? 1, 2, 3. Good job, you're doing great. And this is, I think, a great area for women who don't really want to do Botox, but yet want to kind of, you see I kind of missed a little there, right here. Right there. Okay, so we got this area. I'm going to do a little triangle here to make sure we kind of grab that for this biostimulation process. You okay? Alrighty, good job. Okay, so now we were at, if you remember, our density was 2.4. We're on a spot size of 120 and a pulse energy of 60. Now I can go higher on my energy, but we're gonna do around her eyes right now. So what I'm actually gonna do is put her shields on, and then we're gonna go and we're gonna get as close as we can with that. We're gonna just, you know, just make sure we're gonna turn down our energy though. So yeah, go ahead, you can keep that in there, we're not even working here. Okay, go ahead and raise your head up for me. Sorry, chin up, chin down, lift up your head, there we go. Ponytail, okay. Okay. Okay, so I'm gonna pull this skin. I'm gonna turn her pulse energy. I can already see it's working really well here. You can see this redness. So I'm gonna turn it down just a smidge, and I'm also gonna turn my density down just a little bit, okay? So my density is gonna go to 1.8, and my pulse energy is gonna go to 50 right here for around her eyes, right? So we wanna be really careful. So I'm gonna ask her, can you remember what it's like to put on mascara? So we're gonna have a mascara face, mouth opened, eyebrows up. Go ahead and look up for me. Look up, okay, you ready? Put it on standby, ready to go. Okay, okay, this is gonna be a little zouchy. Please hold still, okay? 1, 2, 3. Good job. Okay, ready? 1, 2, 3. Good job. 1, 2, 3. Good job. We're just tightening the skin. 1, 2, 3. Okay, good. Okay, you're great on that one. Four pulses under here. Little mascara face. You ready? I'm watching that. 1, 2, 3. Watching that. 1, 2, 3. 1, 2, 3. Okay, so we got really tight under there, protected her eyes. So now we're gonna go, relax your eyes. We're gonna go just try to go a little bit above her eyes. So I'm just gonna move this just a little bit and bend this a little more. And then we're gonna treat her upper brow. So I'm gonna keep it at the same density and the same pulse energy. I'm just gonna go smaller on my spot size. So I'm gonna put it at 13. And then I don't know if you could see this. We actually clean ours out pretty frequently, but this is dead skin. So I just take this and go and clean it out. So just FYI, as a little trick. Okay, go ahead and raise your eyebrow for me. Yep, we're ready. So we're watching this spot size. 1, 2, 3. 1, 2, 3. Good job. Did you see that contraction? It's kind of hard, but I'm just watching the skin totally and fully contract all on its own right here. I'm gonna grab that again. One more, you ready? Sorry, hun. There you go, good job. Okay, we're gonna go to this side. You're almost done with these eyeballs. 1, 2, 3, good job. 1, 2, 3. Okay, last one, and then break. Okay, good, nice. You okay? Mm-hmm. Okay, so now what we've done is targeted the areas that really bother her a little deeper. So now I'm gonna do a whole face at the deeper level, but not as intense for collagen stimulation, okay? So I'm gonna actually go down to density of 1.5, so I'm a little less, and put my pulse energy, at about 45. She's awake, so I wanna see what she can tolerate. How are you pain-wise right now on a scale of 0 to 10? 10 being the worst pain you've ever been in?
Like 3, 2.
A 2 to 3, okay? So you can kind of see that redness and see how she's doing. We're gonna go up on our, up on our 15 millimeters, got our scatter. So I'm just using this as kind of a guide. So I'm actually gonna put it in moving mode, and I personally am okay going over these areas again because I have less energy. So I know it's gonna not go as deep. I also know I've got a really good end point for her because it's red, but sometimes you can have an endpoint of pinpoint bleeding, and we're not even there yet. So I know I can push this skin actually a little bit more. So we'll put it on moving mode, and we'll just watch it. Now remember, the faster I go, the more dense it's gonna be. So even though my density is 1.6, I moved it down to the lower end of density so that I can move my hand at a consistent rate for myself, okay? So I'm gonna start here on her jawline. I'm just gonna kind of follow it. Okay, if you see that pass. So, and you can see, like, this is my spots before, this is my spots now.
So I've got way less spots here. Does that make sense? So I know my density is okay. 1, 2, 3. Sorry, you're doing great, hon. How are you pain-wise?
Good.
Good. All right, so I'm just kind of moving this. It's a little shocking when it starts, huh? So I'm gonna kind of serpentine up here. Okay, this one I'm just gonna do, even though I'm moving mode, I'm still just gonna go like a little bit there. Okay, we've got to go here, 1, 2, 3. So now I know I've done I've done a deep level here, and I do a smidgen here. Okay, and I'm totally fine there. Her jawline is a little bit lower here, so I'm going to do another pass here. I'm going to start behind her ear. Just kind of do another pass. There we go. How is your pain? Okay? Mm-hmm. Okay, I'm going to have you take that out of your mouth, and I'm going to do chin really quick and upper lip. Okay? You ready? 1, 2, 3. So getting a little more here, 1, 2, 3. There we go. Okay, I'm gonna cover her lip here just to make sure, but I'm gonna kind of do a little bit more spot. I'm just gonna take pulse on my foot pedal, if that makes sense, versus even though I'm still in moving mode. So I'm just kind of quickly pulsing it. And I'm also looking at, my density here. So how's my density compared to this? Way less, but you can really see that, if that makes sense. So now we're gonna do upper lip. I'm gonna have you relax just a little bit. This one's a little zingy, okay? Right, take another, I don't know, kick a hit of that.
Okay. Yeah.
Okay, hold it in, don't breathe out. Okay, you're ready? Just kind of that same, right? 1, 4 pulses, 2, 3, last one, 4, okay? Sometimes counting down helps people. Again, you can see it's not as dense. We're gonna go over it again in just a second. So, alrighty, so we're gonna finish her jawline here. It's easier for me to go left to right rather than push it, if that makes sense, so. Okay.
Should we have Dr. Troy trying to
Yeah. Okay. So the doctor's going to take over in just a second. I'm going to just kind of do her. So when we get up here is where I usually pull this down a little bit and go the uppers. So do you want to step in for a second and just finish this part? Okay, I'm going to have you turn this way. I did her jawline so we can really see that jawline, and then we just need mid-chin there, or mid-cheek, excuse me.
So we're going to be going across here, just like that.
I
correct?
find it easier to go that way. It's kind of like pushing the machine is a little harder for me. It's a little... Yeah, so I would even go
Oh, you're
over
gonna go
this.
go
Yes,
over those
because
previous-
we're going at a different energy, so it's not going to go down as deep. Does that make sense?
Yes.
So it's okay. When we're really treating like the rhinids and etch lines, I actually do like 3 passes to 4. Because I really want to treat them, guys. Like,
You okay?
how do you like that moving mode?
It's much better.
Yeah.
And did you go over this area yet or not yet?
Nope, I haven't done that a little bit yet, just a little. Good job. So if you're gonna get there, I would turn my machine that way, right? The handpiece. And then have her raise her eyebrows.
Raise your eyebrow just a little bit.
There you go. that one's pretty shocking, so
Yeah.
sometimes warning them helps. So yeah, now move this. Sorry, hun. Yeah, and this is where I'd outline her brow, just like you're doing. You relax your forehead. You're raising your brows. You can just relax those.
And this way just a little bit?
Yeah. Center.
You okay?
Yep. So maybe do one here, and then
Yeah.
you'll know where you've gone. Does that make sense? So sometimes dividing it into quadrants, especially if you're in moving mode, really helps me. You know, if I outline the brow and then outline the hairline and then do it halfway down the forehead, it really helps me know, okay, I've done this area. Yeah. So we just want to make sure, and you're doing a great job, that the pattern here is the same as the pattern down here, pretty close. So what I would do is I would recommend getting a little closer to her brow, because a lot of people like lifting, right? So put most of it, yep. All right, chin down for us, please. There you go. That way your angle's a little better. Does that make sense? So that way they can get that lift with that brow right there. Because this is, if you remember, this is the collagen stimulation piece. This isn't our resurfacing one yet. We're still just collagen stimulating. So yeah.
And then we're going to go over a third time to resurface, you're saying?
Yeah, 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 go for it. You can keep that in your mouth, yeah. I'm gonna pull this down. There you go. So you've got
There's still
this one.
collagen.
Yep, so we're still on that collagen synthesis. We did it much deeper.
So the first time was very deep, just
yeah,
the
but
really
it was
wrinkled
only in
areas.
targeted areas, right? This is gonna
You
be
okay?
an all over one.
And remove the eyepiece just a little bit.
She's doing great, yeah. All right,
And
so
even though
now-
we're in second collagen stimulating mode, you're not concerned about going back over these areas,
Oh
correct?
yeah, you can do it again. Because remember, it was 60 to 100, and I only treated her 60.
I see.
So it can handle a little more. So I would do that again, and I would move it down her nose a little bit. So I can kind of show you how I do
Yeah,
that
please.
one, because it's a little trickier. Sometimes it's a little easier with intraocular shields, but so I'm going to take it off moving mode for me while I do this area, because I want to only give one pulse, if that makes sense. So a lot of the times, I'm going to take these off for just a second and flip them around, okay? Go ahead and lift up. Sorry, hun. So I'm going to put the metal part a little lower, if that makes sense. See how it's right there now? This way I can treat, we're going to have to go back, but it was a little in the way, if that makes sense. So let's see, ready, stand by. I'm at 15, so I'm going to move it a little smaller. I'm going to make my scan a little smaller. This way I can really see what I'm doing, okay? So I made it smaller, 1, 2, 3. Okay, and then right here, push here. You ready? 1, 2, 3. So remember how we talked about feathering? So this is really striking the top of it and kind of feathering it out along the
yes.
sides. So it's not as strong, okay? I also kind of go right here. Can you pull that piece out of your mouth? I'm actually gonna go right here, go right here. That's what I do. Kind of covers those mirrors a little bit, but there we go. You ready? Good job, okay?
So I'm kind of just manipulating the tip of this. I'm so sorry, it's a little ouchier. I use this tongue depressor to kind of block the areas I don't want it to go into, like into her nares and stuff like that. And then just right here, I'm gonna do that wiggle piece. And then, sorry. Okay, so now we've got to treat. 1, 2, 3. Okay, right where the metal was. So I'm gonna pull this off, flip this around. I'm so sorry, it's bright. Get that metal out of the way. Thanks. Yep, you have to clean it out every once in a while. Okay, so you can see right here. So I'm gonna keep it flat and straight and laser right there. I'm gonna come to this other side, keep it flat and straight. 1, 2, 3. But I don't want the nose tip, and I can show you, to go through this. Does that make sense? Because that means there's more energy and heat right where the tip of her nose is, right? So you want to make sure, especially on noses, that we are really careful with the angle of that. Okay, we're gonna do your neck. So I'll do part of it and then, you okay?
Yeah.
Okay, all right, chin up for me. So we have like a line of demarcation. Energy, necks aren't as forgiving, but I think this pulse energy is gonna be great. We're gonna put it on
We
moving.
haven't resurfaced yet.
Yeah. Okay, you ready? Mm-hmm. Okay, 1, 2, actually, let me take it a little bigger. We'll just give us more. Stand by, okay? Right here, 1, 2, 3. So I'm going in there. A lot of the times I pull it out because I want a good treatment there, if that makes sense, because it's hollow. And then you can kind of just follow the line. How's your pain? Good. Okay, we're in moving mode.
Maybe I'll do a little more. See. I'd love to do it. Yeah.
Okay, turn for me just a little bit. That just flexes that. Yeah.
Okay.
Again, clavicles, we try to get over. Let's see here. How are you doing? Okay, I'm going right up to her hairline here. Go ahead and turn. You're doing great. This angle's a little hard. All right, let me just finish this and then I'll turn over to you, okay? Yeah, here we go. Okay, she didn't get numbing all the way over here, so I might go a little faster just so you can tell the difference, huh? Okay, all right, that's the neck. All right.
Well, we've been on 120 this whole time.
Yeah, we're still on
Still
120.
pretty fast for even for 120.
Yeah, so we're still at 120, still collagen, so we're gonna do her neck, and then pretty much the same exact thing at the 350. It's okay. We got
Just stand up for this one, actually.
Here.
I'm just gonna put your earbuds back in for you.
I'll just take them off.
How are you doing?
Good. It's really not bad.
Good. Do you want me to raise the table?
No, it's okay. All right.
Yeah. How's she look?
Pretty good.
Yeah. I use this on the inside of her ear. Does that make sense?
Yes.
There we go.
Oop, you all right?
Yeah.
Okay.
She didn't numb her ears.
Sorry.
It's okay. What does that part do?
Oh, it just tightens up the some of the wrinkles on the ears.
Oh. Yeah. I didn't do this one because she had her earpiece in if you want to grab that. Sometimes I put the tongue depressor underneath it and kind of
that's a
use
good
that to
idea.
like flatten it up, if that makes sense. Yeah, perfect.
Good.
Good job. Alrighty.
Can I put this in?
Yes,
Yeah,
you can. Go
absolutely.
put it in.
I think we did good. So now we're gonna, if you want to grab this little triangle
Yeah,
here.
I do.
Yeah. And you're in moving mode, yeah.
What do you think, Susan?
I think she looks good. We still have a whole nother pass to do.
Yeah, that's true.
So, yeah, so if you want to take a picture of this is what we did like full face and neck, remember? So we targeted specific areas, went deeper and more strong, and then we kind of lightened our energy and changed our density, and we put it in moving mode, right? So that's what we did this pass
Yeah.
for collagen synthesis. Now we're gonna, as soon as pictures are taken,
All right, take this out.
yeah, if you want to.
Okay.
Okay, so now we're gonna take off that hand, the
I
neck
just
piece.
feel like we should go just a touch more right
Yeah,
over here
go for it.
before
Yeah.
we
She didn't numb there, so just be aware.
go quick.
Yeah, she wasn't numb there.
You'll thank me later. Okay.
I know.
Good. And when you're doing resurfacing, you think we should go like down
Oh,
the whole
absolutely.
décolletage? Yeah, for sure,
Yeah,
right?
she didn't numb her décolleté, so we call this from clavicle to chest. And when I do chest, I actually go to nipple line. So this whole thing for me is a chest, neck,
Gotcha.
and face.
I understand.
So, yeah, so we want to switch out that handpiece. This, yep, spot size. Just pull it off its magnet.
Oh,
Yep,
there you go.
perfect. And you might want to show everybody on the camera, but see how it's kind of glucky? Well, I don't know the other word to describe it. But I take a little bit of, yep, suck it out, and then I kind of wipe it out a little bit between my 120 and my 350, just to make sure my machine stays really good. And now we want to grab the other spot size. So the spot size, you can tell what it is because it's right here on the handle piece. You can see that right there.
So where do you see?
Right next to my thumb.
Yeah, right in there. It's kind of embossed a little bit, so it's a little hard to see. And then, yeah, it just fits on. It's like a magnet, so it just kind of snaps in like a magnet.
Okay.
Okay, so now this one is automatically preset. Oh, mine is automatically preset, but this one is the one that we can do more density. Now, so remember, this is spot size. So this one is resurfacing. So this one we want lots of little spots, but not a lot of energy, okay? So I keep my spot size at 42, so that means 40% of my 15 by 15 millimeter size is gonna have spots in it, right? So 41 right here, yep, this is right where it is. This is as high as it will let us go. Okay, so this is giving us a total number of dots of 961 dots in a 15 by 15 millimeter square. Now, the manual says you can do 20 to up to 30. I have pushed that a little bit, but because this is her first time and everything, we're gonna kind of see how she does at 20.
okay? We don't need tons and tons of energy because you get a good resurface with the density, okay? But other than that, it's just the same exact thing that we just did on this last one. And so you can do the full face if you want. So, you know, carve out that jawline, but you're not gonna be able to tell necessarily really where you've already gone and where you're gonna be putting new spots, right? Because she already has these track marks on her. So you really have to be aware of where you've already gone. You could put it in moving mode, but you might wanna just see for a few spots what it looks like, if that makes sense. So we're just kind of see how this resurface mode looks. It goes a lot faster because it's not going as deep.
Doesn't
Yep.
look like scattered.
Yep,
to me.
so click refresh and then click it again. That's random, there you go. And then put moving or a spot, whatever one you want to do. Yep,
Just
there
do-
you go. So you can kind of see what one full spot looks
Wow.
like.
Okay.
So that's why that's pretty aggressive. So that's 41.1. This is why I put it in moving mode, right? So I can leave it at that density and move that pattern up and down. So this is resurfacing,
Okay.
So we don't have to go down as deep. We're not going as deep or as high energy, okay? How's your pain? It's okay? So just move from there yet? Yeah, this one is actually the more painful because it's right where the nerve endings are. So that's why I go fast through it. So. Good job. Breathe in and out and hold that in there for 10 seconds.
You may find it easier to move side to side. Turn that horseshoe so that it's open towards you, and that gives you best visibility, and then you can slide side to side.
Better?
You okay?
Yeah.
Let's take a couple deep breaths of the Pronox for
Yeah,
a minute.
and then you can always turn down her pulse energy too, right? If it's too much, right? So we can manipulate the energy so it's not as intense.
You let me know when you're ready.
Yeah.
Okay.
Go for it. Mm-hmm. Okay, we're gonna go right over here in the cheek, okay?
Sometimes I count out loud and say, hey, we're gonna do 5 seconds.
Yeah.
And then count out loud 5, 4, 3,
Right, we're gonna
2,
do
1.
2
It helps.
seconds. You ready? 1, 2. We're gonna do the upper lip now. You ready?
Like a pulse. Yeah. Oh, you can keep it on moving mode.
Oh,
Just
okay.
only hold your foot down for that quick second. Does that make sense? You can kind of pulse
Ready?
it
1,
in
2,
moving
3.
mode. Okay, yeah. Good job.
Another 1, 2 seconds.
Yeah.
Okay.
Okay.
Go ahead, take a
Take a
breath of
couple
that.
breaths
Yeah.
of the Pronox.
Okay.
Get a little more nitrous. We got to get a little bit more right here.
And one pulse here. There you go. You
Good.
see how you pulled away? So
Yeah.
that means she was even getting less energy.
Yeah.
That's kind of what happened. So that's okay.
All right, we're going to do the chin. You ready? 3 seconds. 1, 2, and then let's take out the Pronox for a second. I'm just going to go around your lower lip. Take it. 1, 2, 3. You can put it back in. You can put it back in. It's okay. Take another deep breath. Let's do 2 deep breaths of the Pronox.
Hold it for 10 seconds.
And take it out for 1 more minute. And just hold your breath for a second. 1, 2, 3. And lower chin, another 3. 1, 2, 3. Good. Okay, you can put your Pronox back in. And now you could just breathe normal. We're just going to do the other side. You ready? All right, gonna take a break. And we're gonna do another 5 seconds. You ready? 1, 2, 3, go. 1, 2, 3, 4, 5. Another 5. 1, 2, 3, 4, 5.
So you can see the little denser part
Yeah.
you did here. So it was just where you turned it around. So just, you know, just little bits. You did great though.
Better to just do a line. Okay. 1, 2, 3, 4, 5. Great.
And then we miss this whole thing right here, so just do the
One
wiggle.
more?
Yeah.
Good.
That air helps
Amazing.
a lot.
Yeah, okay.
Yeah, everything we
Because
pull this
that
down.
one just hurts more, doesn't it?
Yeah. Can we do it to this other side? Did you get far enough on that side? Yeah, perfect.
So compared to a chemical peel, oh, I suppose not here.
What?
Would you call this like a medium depth peel? Do you guys do chemical peels in your office or no?
I do not. We have master estheticians who do them.
Ready? You can use your Pronox if you want.
Oh, I
Yeah.
forgot about it.
Yeah.
So kind of make sure you're a little lower, okay? You're just a little too high from the. That's good.
I see what you mean.
Trying to keep it perpendicular to the
Yeah, I
skin.
see exactly
Yeah.
what you mean. Too high from the skin is what you mean. And we were going to go on the upper lid too?
I do, yeah. But I would turn down your
Yeah.
energy just a little bit more. So you're at 15 right now. So yeah, just turn down your energy. Yep, 10, 12 is good. And then change the size, the millimeter size of that. So, I mean, if you want to do 10, that's great. If you want to do, just
Yeah.
whatever will fit. So yeah, remove her glasses, but have her do the makeup, the mascara face to raise her
Mascara.
brows. Yeah. Just gives you more working area.
Oh, I see. It's much, much lower and you can barely even see where it
Yeah.
went.
That area is really sensitive, so it's okay.
Okay, good.
Good job.
You okay, Kim? Ready to do the last little bit?
I don't think you need this here. I would
Just go
pull her
straight.
up there. Nice. Perfect. All right, and then you've got her nose and her under eyes. Okay. And then full neck. It's kind of like manipulating the. Yeah, count down under those eyes because they're just
All right, we're
really
going to count
painful.
to 5, okay?
Yeah, pull this way.
3, 4, 5. Let's take a break. We'll do a little bit more under here. Ready? Okay, good. And then it's just the nose. there a way to make it brighter? I feel like there
So
must
it's
be,
as
right?
bright as it goes. It's
Oh,
this,
okay. There you
but
go.
it's because there's so many lights
I see,
in
okay.
here. But
No
you
worries.
turn that little knob on the top. Yep, I already checked.
Okay, no
But
worries.
it's because of the light in
Gotcha.
here.
All right, perfect.
Okay, neck, full neck. So, yep, move the size up to that. And let's put her back to an energy of 15 at least. Just because, over here. Yep, just because we want to give her a good treatment. You could do 20. Remember, the neck is just not, it just takes a little bit longer to heal, is really what it is. So, yep, all right, chin up to the ceiling as tight as possible.
We're gonna start in the middle.
Yeah, and this is where I stand a lot too. Remember, we talked about that. Just so that you're, comfortable and, right? Because you're delivering the
Positioning is
treatment.
everything.
Yes, exactly.
That's what
Sometimes
we
I raise
say.
the table as high as it goes so I don't hunch over my back.
Yeah, yeah, she's, we turn this in she's getting You want to pass through? Yeah. So we're gonna grab.
Yeah, we just have her neck to do. We're going over there, turn.
Yeah.
There you go. The tighter the skin is also helps you move and glide a little easier.
Okay. Lift the chin up all the way for me again.
We're almost done.
Almost done, Kim.
You're doing so good. Probably another 2 minutes and then you're done.
And then I'm just gonna have you put your chin down just a little bit.
Good job. I know it's hard on the neck too, but like try hard to like keep it perpendicular. I know it's hard, but you know, it kind of catches and pulls a little bit.
Yeah.
So yeah,
It's all right.
that's good.
This is just a little bit.
Looks good.
Okay, good. All right.
Torture done.
Torture done.
If you need this with cool air.
Yeah.
For a second.
What'd you say?
I said things
Just for
right
a
just for a second.
Yeah. When our patients recover, they actually hold the Zimmer.
You want to hold it for a little bit and put it where you want it? Yeah, why don't you do that? There you go.
Can I take it with me?
The Pronux?
No.
All
Zimmer.
right. All right. So we saw that that second pass, really, that resurfacing pass was a lot more painful, huh?
Yeah, it really was.
Yeah. That's superficial, and it re-stimulates and gets rid of this dead top layer. So I'm so sorry. It's painful. So what we're going to have you do now is kind of help with your post-treatment care, if that makes sense. So what we're going to have you do is I'm going to just kind of put a little Silvadene gel on you. So that's just kind of a mist or a gel that helps with burns, okay? This, you can sit here and relax and hold this cold air. A lot of our patients use like fans, like handheld fans, just kind of blowing on them. I also recommend a lot of them when they're going home, turn on their heated seats if they have them, but turn the air conditioner on. So it's actually cold air blowing into your face. So that really helps. Over the next 3 to 4 days, you're gonna not have any sun exposure, okay? So if we go outside, we're gonna wear wide brim hats. We're also going to only go outside if the sun is below the horizon, okay? So that means you're door dashing, that means, you know, you're really avoiding that sun exposure. So for our more aggressive, and this was a moderate to aggressive treatment, what we recommend is cleaning the area with a gentle, mild soap to get off the balm that we're going to put on. So we're going to put on kind of a, kind of like an Aquaphor, if you will. Okay.
I need Vaseline. I'm allergic to Aquaphor.
Okay. Yeah, that's no problem.
And I think I brought some.
Okay. Perfect.
So.
Yeah. So we just want to make sure it kind of keeps it protected, if you will, so nothing can get in it. You want to avoid hot showers, hot saunas. Hot water is actually going to make you feel steamy and hot. Does that make sense? Yeah. If you're going to wash or shower, I'd make it like a lukewarm or even a cool amount. That's going to be really soothing for you. Okay. And then like every 4 to 6 hours, you're just going to kind of scrape off the product that you're going to have. What is it? Not the Aquaphor.
The Vaseline.
The Vaseline. Okay, I'm sorry. Scrape off that Vaseline. We don't want it glopped on. We just want it very, very like a fine layer. Okay. It will get dry. It will get patchy. So for 4 days, you're going to kind of keep it really just softer and a little moisturized.
So with the Vaseline, you kind of like just take it off and then reapply it?
You take it off, wash your face, and that's where if you have like some hyperchloric acid spray, you can spray that on. We have our patients use what's called nectar, but you know, just keeping it covered, if that makes sense, with the Vaseline.
Okay.
Yeah.
So you kind of wash the Vaseline off and then reapply it every 4 hours.
Yeah, about 4 to 6 for you. It's going to be more like 6 hours, which is just 3 times a day. So morning, mid-afternoon, so we can kind of look at it, and nighttime.
And what about vinegar? Somebody said something.
Yeah, so some people use a 1-to-1 vinegar with water soaks. So you would just take a little bit of gauze and dab that on. What it does is it neutralizes some of the burning. I personally don't recommend my patients do that anymore because they said it hurt them so bad. So I personally don't recommend the vinegar, but you could try it and maybe you would feel fine for you. But for some reason, my patients felt like it burned a lot more.